connected through online. For the celebration of Golden Jubilee of Department of Studies in Food Science and Nutrition and to commemorate the special days of November 1, Infant Protection Day, UOM Day, World Prevention Day. I am happy to announce that the today national webinar will be inaugurated in a while by the Honorable Vice Chancellor, University of Mysore, Mysore. Quote Shakespeare, small cheer and great welcome makes a merry feast. Welcoming all to this webinar is a responsible duty of the organizer. I invite Professor Kola and webinar convener to deliver welcome address and to introduce him to the audience.
Good morning and greetings to one and all. Respected Honorable Vice Chancellor, Professor Hemant Kumar Sir, beloved Chairperson, Professor Asna Ulrich, distinguished resource persons, faculty members, research scholars, students, registered delegates from foreign countries, different states of India, and media people. We have gathered here to conquer the challenges of neonatal care and infant protection, especially in Indian context. I am highly honored to take this opportunity on behalf of the department and the University of Mysore to welcome all of you today for this two-day national webinar on the occasion of Golden Jubilee of the Department of Food Science and Nutrition and to commemorate the special days, namely Infant Protection Day, that is on the 7th November, Newborn Care Week, 3rd week of November, that is 15th to 21st, and World Prematurity Day, 17th November. It gives me immense pleasure to acknowledge all of your presence in the interest of neonates and infants. It gives me tremendous contentment to be presenting the welcome speech amongst the most esteemed personalities who have won the honors in their respective fields. The first and the foremost, I extend warm welcome to Professor Hemant Kumar Sir, Honorable Vice Chancellor, University of Mysore, for gracing this occasion of Golden Jubilee celebration and commemorate the special days of November month. So Professor Hemant Kumar Sir found to be great supporter for organizing academic events in the campus. So far, more than 70 such webinar conferences has been held under his regime as a Vice Chancellor during the COVID-19 pandemic period 2020. And Professor Hemant Kumar Sir has conducted several workshops, national, international conferences. He has won the several awards for his academic excellence. As a distinguished researcher, he has published more than 500 research articles, books, book chapter, and he has over 1,446 scientific citations and H-Index 24 for his research contribution as of now. As an administrator, Professor Hemant Kumar Sir served as chairman of the Department of Computer Science, chief coordinator of IOE, ICD, Chinese program, e-governance, high performance computing, director of International Center. He has been very successful in designing and running the joint MOU programs between China and University of Mysore, and Sir has academic and research collaboration with European Commission of Education, University of Barcelona, Chinese Academy of Science, BC. Even with his busy schedule, Sir accepted our invitation to inaugurate this webinar and to deliver inaugural address. On behalf of the department and on my personal behalf, I express hearty welcome to Professor Hemant Kumar Sir, Honorable Vice Chancellor of University of Mysore. I would like to extend my earnest welcome to the resource person of this two-day national webinar, namely Dr. Mallikarjun, Professor of Pediatrics, MS Ramaiah Medical College, Bangalore, Dr. Arun Gupta, Central Coordinator, Breastfeeding Promotion Regional Coordinator, IDFA in South Asia, New Delhi, Professor Jamna Prakash, former faculty, Department of Studies in Food Science and Nutrition, University of Mysore, Dr. Sudha Rudrappa, Professor and HOD, Department of Pediatrics, Mysore Medical College, Mysore, Dr. Kuldeep Singh, Professor and Dean of Academics, HOD of Department of Pediatrics, All India Institute of Medical Sciences, Jodhpur, Professor Venkatesan S, HOD, Department of Clinical Psychology, All India Institute of Speech and Hearing, Mysore. They are all highly knowledgeable and eminent persons in their field of specialization. We are fortunate to have them as a resource person of this webinar. On behalf of the department, University of Mysore, and on my personal behalf, I extend hearty welcome to all the resource persons of this webinar. I wholeheartedly welcome my colleagues from the other universities, Dr. Arokya Maraiselvi, Dr. Ramya Bhaskar from Avinash Lingam, University, Coimbatore, Dr. Shobhaji, Dr. Venkatakshmi from VHT Central Institute of Home Science, Bangalore, Dr. Anita C from KSU Mysore to this webinar. I wish to acknowledge their support and cooperation as a moderator in conducting the scientific session of this webinar. A leader takes people where they want to go. A great leader takes people where they don't necessarily want to go but ought to be. The chairperson of the department, Professor Asma Uruj, is a great leader leading the department as well as leading Golden Jubilee celebration of the department. I extend warm welcome to our beloved chairperson, Professor Asma Uruj, to this webinar. Since this webinar is organized as an event of Golden Jubilee of the department, I express my earnest welcome and gratitude to all former faculty members. Professor Padmamapati, Professor Rudrama, Professor Saraswati Ji, Professor Shashikala Putraj, Professor Karanisa Begum, Professor Jamna Prakash. I sincerely welcome all invitees, registered delegates, participants, faculty members from the campus, research scholars and students of this webinar. I must mention that more than 550 people have registered for this webinar from Indonesia, Pakistan, UAE, even from the other states of India, Jammu Kashmir, Rajasthan, Maharashtra, Odisha, Shillong, just to name few. So I extend warm welcome to the technical person from ICD and IOE of University of Mysore to this webinar. They are the backbone for organizing this webinar and e-conferences. The last but not the least, I extend a hearty welcome to media people who have come over here to give the wide coverage of the webinar. Before we begin the webinar, I would like to express my heartfelt welcome and gratitude to all of you who are sincerely committed to this event to make it a success. This event would not be impossible without the support of each and everyone in the department. Then coming to the introduction of theme of the webinar. The theme of the webinar is challenges of neonatal care and infant protection. This theme was chosen with the three reasons. The first, the Department of Studies in Food Science and Nutrition was started in the year 1970. Formerly, it was known as the Department of Studies in Home Science until February 1994 by the University of Mysore. The department is offering the two postgraduate programs and doctoral degree programs in food science and nutrition and human development. So the Department of Food Science and Nutrition is celebrating its Golden Jubilee year during 2021 academic year. On this occasion, as a good academic gesture, the department is organizing the events like e-conference, webinar, and also commemorating the special days. Human development, the second point, human development is a multidisciplinary subject focusing on biological, cognitive, emotional, sociological, and psychological development of the human being from the moment of conception till old age. So, human development students, after their post-graduation, work in a field related to normal children, special children, women, and elderly people at government and non-governmental agencies. They have moral responsibilities to take care of the individual and family as well as at the community level. The third point, as as you are aware, neonatal care and infant protection is of a public concern and current issues to deliberate on. The neonatal period carries the highest risk of mortality than any other period during the childhood. The infant mortality rate in the world dropped, but still the significant decrease in the childhood mortality rate, but captivating much slower rate. This could be due to multiple factors that has hampered achieving the MDG 4 goals. Then, as you are aware, globally, more than 200 million children do not reach their developmental potential in the first 5 years because they live in a poverty and they have a poor health services, nutrition issues, psychosocial care. This disadvantaged children do poorly even in school, academic, subsequently they have a low income, high fertility, then severe undernourishment, complemented with a lack of developmental monitoring and screening, providing the poor care for their own children. So as you are aware, seminars and the conferences are organized and conducted for the audience to gain the insight and the information that would remain effective in their life and as well as to implement in their work and community. So each topic of discussion and debate for today's webinar was chosen and keeping in mind the interest of neonates and infants. So on the occasion of commemorating the aforementioned special days, the department takes the immense pleasure and the responsibility of spreading the awareness on importance of care and management during golden hour of preterm and term neonates among the healthcare professional and child development professional to play an effective role in community outreach program. Hope this deliberation not only enhance the knowledge of neonatal care and infant protection and also motivate the young minds to take up the research related to neonates and infants, especially of community and hospital-based studies to address the challenges faced by the health professional, community workers, and even the role of parents, family in neonatal care and infant protection. This webinar also helps in understanding the vital needs and issues of neonatal care and infant protection by adopting comprehensive, holistic, and intervention approach to have a better insight for prevention and management of newborn complications, which can otherwise prove fatal. Thank you.
Thank you, ma'am. On behalf of the department, I extend a warm welcome to Professor Komla for the webinar. Land lighting is considered as auspicious traditional ceremony where the darkness of ignorance is swept away by the dawn of self-realization. I consider it a great honor to invite Honorable Vice Chancellor Professor G. Neonatal to inaugurate the event by lighting the lamp. I also request Professor Asna and Professor Komla to accompany the Honorable Vice Chancellor for the inauguration of the seminar national webinar. Thank you, sir, for inaugurating the national webinar, and thank you, madam. I now earnestly request the Honorable Vice Chancellor, Professor Hemant Kumar, to deliver the inaugural address.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. Very good morning to you all. Today, the Department of Human Development and Evolution, Science and Nutrition is organizing this national webinar, Challenges of Neonatal Care and Infant Protection. I'm very happy to inaugurate this as a Vice Chancellor of this university. Dignitaries on the dais, Professor Asnauruz and Professor Komala, and many resource persons for all online. And also most of them are very senior professors and eminent teachers. So I will be delivering the lectures in this webinar. I congratulate all of you on this occasion. The department journey for 50 years is not a small thing. That too in the University of Mysore, which has completed 104 years. And moving towards what we call last month, same date, we had our the centenary convocation. The same day you are conducting this national webinar today. So this national webinar, this 50 years of journey, definitely all the teachers who have contributed and all the professors who have worked here really made up this department very well. And those who are working currently, and really the researchers are gone out of this department and are working towards what we call the research. Definitely they are the contributors of the development of the department. So this department has got its own history, its own name, and given today it has maintained. So first of all, I must congratulate on behalf of the university. I must congratulate all the teachers and all the research students who have contributed for this. With this, the today's occasion of golden Jubilee celebration, and to commemorate two special days, namely Infant Protection Day of November 7th, and also Newborn Care Week of 3rd week of November, the World Premature Day, Prematurity Day of November 17th, the Human Development Wing of the Department of Studies in Food Science and Nutrition is organizing this seminar, this national webinar on 19th and 20th of November. I congratulate the organizers for selecting the current issues and the deliberations and to create awareness among academia and the child development, child health care professionals. India is a huge populated country with 1.38 million, that is equivalent to 17.7% of total world population. This figure indicates India is not set to overtake China, as the world's most populous country by 2027. Conversely, India is contributing to the highest number of neonatal deaths and low birth weight and prematurity in the world, that is assumed first place with the highest number of 522,000 of newborn deaths. With the birth of 25 million children every year, accounts nearly 1/5 of the world's annual child births. 1 in 7 babies worldwide born is low birth weight, and every minute one of those babies dies. Globally, 2.4 million babies dies in the first month of the life. This is as per the statistics 2019. The importance of neonatal care is and survival has been recognized by the policymakers, and series of the programs have been launched by the government of India to reduce NMR and IMR. The trajectory trend indicates that India has made a progress in the reduction of the newborn mortality, with the share of the global newborn mortality burden coming from one-third newborn deaths in 1990 to one-fourth of the total newborn deaths today. It is appreciable that there is a decline in neonatal mortality rate, but it is slow. The quality of the life of the children during the postnatal period is highest concern of the today's world. Those who survive more likely to suffer with both immediate and long-term outcomes. The consequences of the low birth weight and also prematurity continues into the adulthood, increasing the risk of the adult to set into chronic illness and health conditions such as the obesity and diabetes. The health is a state subject which is even depending upon enormously with social, cultural, and economical diversities of our country. This poses a big challenge for the planners and all the health professionals and also community health workers. The malnutrition being the underlying contributing factors, making the infants and the children more vulnerable to the severe diseases. More than 70% of the population of our country is living in the rural and urban slum areas. The poor nutrition is the first 1,000 days of the child's life can lead to stunted growth, which is associated with the impaired cognitive ability and also reduced school and also work performance. The importance of the development screening in India needs to be prioritized as what we call preventive strategy. This is a vital need to address the issues of neonatal care and infant protection by adopting comprehensive and holistic and intervention approach to have a better insight for the prevention and the management of the newborn complications, which can be otherwise prove fatal. So, with this background, the webinar theme and the sessions of the topic that is chosen is very relevant to address the prevailing issues of the neonate and also infant in the current days. With this, I congratulate the Department of Food Science and Studies for organizing this webinar. So throughout the year, I think they are doing this program. So let this program be more and more useful to all our researchers and also all the teachers from this university, from other university. I wish you all the best. Thank you.
Thank you, sir, for your constant support and encouragement. No duty is more urgent than that of returning thanks. Vote of thanks provides the opportunity to show our gratitude to people who are directly and or indirectly involved and put their efforts and time to organize this year. It is my privilege to invite Professor Asna Aluj, Chairperson, Department of Studies in Food Science and Nutrition, to extend the vote of thanks.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. A very warm good morning to all on a winter day. Honorable Vice Chancellor, my colleague Professor Komala, I see Professor Gangadhar also in the audience, my beloved faculty members, students, research scholars, and most of all the webinar participants and the speakers. I stand before you to convey our heartfelt thanks to each one of you who have contributed in the organization of this second event of in the series of Golden Jubilee year of the Department of Food Science and Nutrition. As our Vice Chancellor mentioned, achieving 50 years, completing 50 years in a university setup is on its own an achievement. and to commemorate and celebrate and to recall what has gone into those 50 golden years is itself a great challenge. We had several plans, but unfortunately, nature had something else, and here we are. Yet that has not dampened our spirits. So, in some way, we have found, thanks to the technology and on the facilities which have been created in the university, we are still able to conduct and connect with each one of them through the technology to various participants from various countries, and that I think is really remarkable. Well, anyway, to keep the spirits high, we are planning and we are continuing in this direction. So, as I mentioned, this is the second event in the Golden Jubilee series, and we wanted to commemorate many events which fall in this November. And to have chosen this topic, challenges of neonatal care and infant protection, itself is remarkable because though India has made a lot of strides, Vice Chancellor also mentioned about certain statistics and all like we spoke. Though we have made a lot of improvement in healthcare and medicine, but still we lag behind. Our neonatal mortality rate still is not much lower as it is in any other developed country because we are still developing. And our infant mortality rate, maternal mortality rate, all still stand reasonably higher. And newborn screening is something which is not happening in our country, though rarely it happens in some elite hospitals. This is very important in order to prevent the infant from developing either involuntary of metabolism, which he or she has been born, or to prevent any kind of health consequences. Especially we are concerned, see, the child is born with lower birth weight. The child is more at risk of developing obesity or diabetes in later years of life. And this comes from the famous Barker's hypothesis, that is the fetal origins of adult disease. So, to deliberate all these, we need many professionals from pediatrics, from the teaching community, and from the practitioners of nutrition and practitioners of pediatrics and other aspects. So, therefore, this is a very good event, and we have got very good speakers. And on behalf of the University of Mysore and our department, I first of all thank and welcome once again. Though welcome is already done, but as a gesture, though the event is not yet over, but still I thank all the participants who connected through the web link and all the resource persons, the moderators for having been part of this event. I extend a very warm vote of thanks with gratitude to our Vice Chancellor, who is definitely a pillar of support to everyone. Like whatever activities you want to do, anything which is positive, not the positive what we are using today, not in that context, but positive, I tell you. So he has always been very supportive, and amidst all his activities, he takes time off to come personally, and I think that is a very good gesture as the Vice Chancellor of the university. On behalf of all the participants, on behalf of the department, sir, I extend a very warm vote of thanks to you. Thank you very much for your support, and we look forward for continuous support, which I am sure you will extend it to us. I also extend our heartfelt thanks to the University of Mysore authorities, the IOE auditorium, the IOE staff, the IT personnel here who have given us all this support in telecasting this event live. I once again thank all the participants, the speakers, the moderators, and not to forget my own staff, research scholars, and students. Though the doors have been open for students to come and attend the classes, we still see very thin attendance. I think slowly it will pick up. But however, many all were registered, and I thank each one of you for having been part of this event. And not before I would be failing in my duty if I don't thank Dr. Komala for taking the lead in organizing this event. Though we are all hosts, but still it is my duty to say thanks to her also for taking this, leadership and the opportunity to organize this. So once again, I also thank the media for coming here and covering, and also for all the coverage they have been giving with regard to the department activities. I would say that community outreach has been one of the strengths of our department. Way back from the time they have started, and so we continue in this direction. And I would be failing my duty if I do not thank all my earlier staff and who have all been my teachers. So they have their commitment, their contribution certainly has yielded fruits. And I feel I wish they were all here today with us as faculty, as the present faculty, in order to see the growth of our department. Nevertheless, their blessings and best wishes are always with us. So with this, I once again thank all of them who have contributed in making this event a success. Thank you so much.
Thank you, Professor Asnavishma. I'm happy to announce that the high tea has been arranged outside the auditorium. I request the delegates physically present here to go in small group, maintaining social distance to get your refreshments. Dear participants on the online platform, we shall start the technical sessions in few minutes. Please stay with us.
It's audible. Use some other technical.
ಅದು ಇಲ್ಲಿ ಸ್ಕ್ರೀನ್
ಸ್ಕ್ರೀನ್ ಹಾಕ್ತು ಕೆಳಗಡೆ ಬಟನ್ ಸರ್ ಅಲ್ಲಿಗೆ ಬ್ಯಾನರ್ ಫೋಟೋ
ಅದು ಅನೌನ್ಸ್ ಮಾಡಿದ್ರು ಅವರು ಸಾಕಾ
ಒಂಚೂರು ಕೆಳಗಡೆ ಮಾಡಿ ಕೆಳಗಡೆ ಫುಲ್ ಕೆಳಗಡೆ ಬೇಕು ಫುಲ್ ಕೆಳಗಡೆ ಬೇಕು
ಅದು ಅಲ್ಲಿ ಕರೆಕ್ಟ್ ಆಗಿ ಸೆಟ್ ಮಾಡ್ತಾರೆ
ಸರಿ ಮಾಡಿ ಹಾಕ್ಬಿಡಿ ಏನ್ ತೊಂದ್ರೆ ಇಲ್ಲ ಮೇಲೆ
ಇದು ಲೈಟ್ಸ್ ಆಫ್ ಮಾಡ್ಬೇಕಲ್ಲ ಸರ್
ಇವ್ರು ಆರೋಗ್ಯ ಅವ್ರು ಕನೆಕ್ಟ್
ಹಾಂ
ಆಗಿದ್ದಾರೆ ಆರೋಗ್ಯ
ಅದೇ ಮಾತಾಡ್ತೀನಿ. ಹಾಂ ಮ್ಯಾಮ್ ಹೇಳಿ.
ಸರಿ ಸರಿ ಇಲ್ಲಿ ಲೈಟ್ಸ್ ಆಫ್
ಅದೇ
ಮಾಡಿ.
ಕೋರ್ಸ್ ಮಾಡಿದ್ರೆ ಇದೇ ಈಗ ನಾನು ಮಾಡಿಸ್ತೀನಿ. ಹಾ ಇವಾಗ ಮಾಡಿಸ್ತೇವೆ ಮ್ಯಾಮ್. ಈಗ ಸೆಷನ್ ಆಗ್ಬೇಕಾದ್ರೆ ಆರೋಗ್ಯ ಮ್ಯಾಮ್ದು ಮತ್ತೆ ಅವ್ರದ್ದು ಮಲ್ಲಿಕಾರ್ಜುನ್
ಈಗ ಅವ್ರು ಸರ್ ರೆಡಿ ಇದ್ದಾರೆ ಆಲ್ರೆಡಿ ಒಂದ್ಸಲ ಅದು
ಸರಿ
ಹೇಳಿ.
ಮ್ಯಾಮ್.
ಆಯ್ತು ಅವ್ರು ರೆಡಿ ಇದ್ದಾರಾ ಫಸ್ಟ್ ಮಲ್ಲಿಕಾರ್ಜುನ್ ಅವ್ರು ಫಸ್ಟ್
ಗೋಸ್ ಮಾತಾಡಿ.
ಸ್ಪೀಕರ್
ಮತ್ತೆ
ಆರೋಗ್ಯ.
ಆರೋಗ್ಯ ಮ್ಯಾಮ್.
ಹಲೋ
ಇದೆ ಕ್ಲೋಸ್.
ಇಬ್ರು ಮೇಲಿದ್ದಾರೆ ಅವ್ರಿಬ್ರಿಗೂ ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಳಕ್ಕೆ
ಈಗ ಹೇಳ
ಅಂದ್ರೆ ಇಲ್ಲೇ
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 ಮಾಡ್ತಾರೆ.
ಸರಿ ಫೋನ್ ಮಾಡಿ.
ಅನೌನ್ಸ್ ಮಾಡ್ಬೇಡ ಮಾಡ್ಬಿಡುತ್ತಾನೆ.
Ladies and gentlemen, without further ado, let's start the scientific sessions of the national meeting. Dear delegates, kindly drop your questions in the chat box and please keep your audio and video turned off during the presentation by speakers. I repeat, kindly drop your questions in the chat box and please keep your audio and video turned off during the presentation by speaker. The first scientific session focuses on essential newborn care.
ಲೈಟ್ ಆಫ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಅಲ್ಲಿ ಆನ್ ಮಾಡಿ.
Professor of Pediatrics.
ಈ ಕಡೆ ಇದು ಮಾತ್ರ ಆಫ್ ಮಾಡಿ. ಹಿಂದ್ಗಡೆ ಬಿಟ್ಕೊಳ್ಳಿ, ಇದನ್ನ ಮಾತ್ರ ಆಫ್ ಮಾಡಿ ಸರ್.
I now request Dr. Arogya Marachalvi, Associate Professor, Department of Human Development, Avinashi Lingam Institute for Home Science and Higher Education for Women, Coimbatore, to introduce the resource person and moderate the first.
ಅವ್ರದ್ದೇನ್ ತೊಂದರೆ ಇಲ್ಲ, ಅವ್ರೇನ್ ಬೇಡ.
Over to you, Dr. Arogya Marachalvi, ma'am.
Very good morning, delegates. Can you hear me? Am I audible?
Yes, ma'am. Yes, ma'am. You are audible.
Okay. Okay, thank you. Very good morning to all delegates. I deem it a great pleasure to welcome you all for the first session of the two-day national webinar on the theme Challenges of Neonatal Care and Infant Protection. In commemoration of Infant Protection Day and Newborn Care Week, the organizers has judiciously meted out the sub-themes and invited right speakers to transform the objectives into knowledge. Furthermore, my humble thanks for giving me an opportunity to introduce the eminent speaker, Dr. Mallikarjuna, Professor of Pediatrics, Ramaya Medical College, Bangalore. He has a teaching experience of more than 25 years. A pediatrician by profession, he is a person who tirelessly straddles the role of a teacher, a mentor, and a practitioner. His profile makes it very clear that he is a doctor who has the potential to guide students from the realms of textbooks to the continuum of care. At present, he holds a prestigious position as President-elect 2020 of Indian Academy of Pediatrics, Bangalore. He was also holding 2 positions in the Clinical Information Access Portal as an executive board member and as a national coordinator for Committee on Nutrition Advocacy in the year 2018 and 19. Certain other prominent functionaries held by Dr. Mallikarjuna were being the Vice President of Karnataka State Indian Academy of Pediatrics, IAP of Bangalore District, and he was also the founder secretary of IYCF Karnataka chapter. And he had served as secretary for 2 years between 2016 and 18 in the Commonwealth Association for Health and Disability, which is in official relation with WHO. One remarkable contribution of a guest speaker is that he had developed a 4-in-1 course training module encompassing breastfeeding counseling, HIV, complementary feeding practices, and growth monitoring during his incumbency as an international course director and national trainer for WHO and UNICEF. Dr. Mallikarjuna is a life member of several prestigious medical councils. The most renowned awards received by our chief guest are Distinguished Service Award, Best Individual Award accredited by WHO, Baby Friendly Hospital Initiative Assessor Award, Best Scientific Award, Dr. Bopaya Award, to name a few. Altogether, I would say that Dr. Mallikarjuna is a new kind of medical leader as visioned by his current organization, the Ramaya Medical College. The profile of the lead speaker evidently says that he is the most sought guest speaker at international and national forums and academics. Human Development Department of the University of Mysore has made a right decision in inviting Sir to speak on essential newborn care. Now on to you, sir. Thank you all.
Good morning, everybody. At the outset, Honorable Vice Chancellor of Mysore University, Dr. Komala, and her team, the whole organizing team, I thank them for inviting me as guest speaker for the most, sort of the university, the Mysore University, which all of us know.
Perfect. Neat.
Now, yeah, the efforts of the team, I appreciate the efforts of the team, aptly selecting the, the titles as well as the speakers from all over India for doing justice for this, commemorating the newborn week and the child protection week celebration as a part of the Golden Jubilee celebration of the Department of Food Science and Nutrition, Manas Gangotri, the Human Development. It gives me immense pleasure to be part of this team and also to rightly, put it across about the basic newborn care, which is a very, very important. Even before the medical science and the practices existed, these practices were practiced in the community by our, ancestors in a very, very very right manner. And then it has been the practice with the traditional practice, and then it has been the traditional practice which has evolved as science, and over the years we have developed the basic care, advanced care, the neonatal care. Everything is designed and targeted towards the child survival unfinished agenda. From the time of my grandmother's time till today, we are trying to save the small babies, premature babies, low birth weight babies, babies who are born with the difficulties like birth asphyxia and so on and so forth. So it is a never-ending agenda we have to keep on doing. It is a continuous process. As we come across the newer problems, we have to design the newer treatment and the care for these children. So that, rightly mentioned in the introductory speech by our Honorable Vice Chancellor, that the mortality has to come down, the suffering due to illnesses, due to this, all these problems, the morbidity has to come down. That is the whole purpose of even our government of India and the state government. So with this, brief, information and preamble to my talk, I will, without wasting much time, I will move on to the title proper so that the audience will be clear about what I am speaking. My lecture will definitely not be about the theory part of it, the very practical part of it. Why? Why do you think this topic has been chosen by our team? The importance of newborn care, because the mortality has been very high, which are almost all of them are preventable. These deaths can occur during the delivery time or immediately after birth due to problems, or due to the child may have difficulty in breathing, we call it as asphyxia. Then an infection, that is, if the environment is not clean, these young small newborns can catch infection, and all these can be prevented. That's the beauty of the science, which has evolved, understood the situations in bringing down the preventable causes for death of these newborns. So which has to be provided at the time of birth only. So it is broadly classified as during the birth, on the day of birth, intrapartum, that is during the birth, 21% deaths are there, and total mortality amounts to 5.5 million. The same thing in the year 2001 and 2002 was almost 10.2 million deaths all over the world. And then it has, after the good practices of newborn care have improved, and breastfeeding initiation, and then vaccination and immunization, it has come down from 10.2 million to around 8.2 million. So there was a huge, by 2008. Now it has come down further in many states, but few states which are underdeveloped still are facing the problems. The only answer is to provide the basic newborn care and all the topics, care of the low birth weight, asphyxia, how to prevent infection, how to promote the natural food, the mother's milk, which also gives the immunity to baby, all these babies, to fight against these infection and the neonatal problems, to overcome successfully for the best of the survival. So rest of the remaining can be prevented with the vaccination and other things. I will focus on only the newborn care. So what is important here is we need to note down the time of birth so that we can assess very clearly as soon as the baby is born in the labor room. We should know before the delivery happens whether the baby mother has completed 9 months or not. Mothers who have completed 9 months will be called a full-term normal babies. The babies who are born before that, suppose the mother has completed 8 months of gestational age and then she delivers, it is called a premature baby. Baby size may be appropriate for 8 months, but it is called a premature baby. The total gestation, the maturity is not complete till they complete 37 plus weeks in utero. So it is very important to understand the before delivery, this thing. Then it is important to know whether they had antenatally, before giving birth, they were getting checked, having their normal routine checkups at the health facility, the hospitals or the government hospitals or private nursing homes, depending on their affordability. If they are on a regular antenatal checkup before the delivery and all the precautions are taken, necessary basic screening tests are done to ensure that the baby is healthy, growing well, and the mother is also healthy and safe and ready to deliver. These things have to be ensured. This is one of the most important aspect to bring down the mortality and morbidity, and to provide best of the newborn essential care as soon as the baby is born. Because we have all the information about the growth of the baby and the health of the mother, the condition of the mother, any problems are there or taken care. For example, while doing a scan, which is done for detection of anomalies antenatally, we can be prepared. If the baby is going to be born with a heart problem, a baby is going to be born with a neurological problem. For example, baby is going to be born with prematurity, the risk is high, and other genetic abnormalities like Down syndrome, chromosomal anomalies, etc., etc. So we will be well prepared for receiving them at the right time, at the right place, and in the right environment is a very, very crucial thing that we all of us have to keep it in mind and be prepared for that. So let us start as soon as the baby is born, presuming that the baby is normal. Then it is very important to note the time that the baby is born at such and such a time. Did the baby cry in how many minutes, so that the lungs are well aerated and baby has, after the baby gets separated from the mother, in utero baby will be getting all the nourishments and oxygen through the umbilical cord and the blood supply. Once the baby's umbilical cord is cut, as soon as the baby is born, baby has to cry and establish its own breathing mechanism. The baby becomes autonomous. So once the baby is delivered, make a note of the time, because every event has some norms defined. Baby has to breathe within what is the breathing in 5 minutes and then 10 minutes, what we call Apgar score. So it reflects that baby is well oxygenated or ill oxygenated. Then it is important to understand that the baby is in a clean room. That's why you see in hospitals, labor room, delivery rooms and all, many are not allowed. And it is a very clean place, a warm place, and very dried and kept in a very hygienic environment, so that it makes a very, very warm welcome to these babies. At the same scientifically aseptic areas, so there is less likely these babies are going to get infection. As soon as the baby is born, it is very important to check the breathing, whether it is normal. Up to 60 times breathing is normal, and rest of the things like chest in drawing and all have to be thought of, or any sound while breathing and all, we call it grunting, have to be observed to know whether the breathing is normal or abnormal. I will not go into the details of other things. As soon as the baby is born, by wiping the body, and we are trying to clean that baby, because baby is in the medium of fluid even before the baby is born. So by wiping, less likely the child is going to become cold and the warmth is well maintained. The cord has to be, umbilical cord has to be clamped, waiting till the cord pulsation stops. Generally, this happens in 1 to 3 minutes, and it has to be clamped so that the baby will receive good amount of blood, so it will not have any other anemia and other problems. At the same time, the baby, as soon as the baby is born, baby has to be put on mother's chest, the skin-to-skin contact, what we call, so that the mother's body warmth acts as an incubator, natural incubator, to maintain the temperature. And if the baby is put between the chest, then it is called kangaroo mother care, so that the baby's warmth is well taken care by the skin-to-skin contact, and also a lot of tactile stimulation for the baby to move onto the breast and latch on well. Each baby needs to be labeled, because in a situation where there are more than 2-3 mothers delivering, there should be no confusion, and there should be a label or identity for ID for each of the babies. So head has to be covered properly, so that the loss of the warmth is not going to occur, which can lead to hypothermia. So the mother has to be well covered, the baby with a warm cloth, preferably the cotton combed soft cloths. Encourage immediately, as soon as if everything looks fine at this stage, baby has to be immediately initiated breastfeeding within half an hour, or as soon as the baby's cord is clamped and put onto the chest for skin-to-skin contact and the warmth. At the same time, the baby can have the warmth as well as the best feed, the first breastfeed. And routinely we give vitamin K administration as a routine normal care to prevent the expected other problems. If the baby is not crying when we do all these steps at the time of birth, or it's not breathing well normally, that indicates that the baby definitely requires a special attention, and resuscitation needs to be done to make sure that the difficulty in breathing is taken care well without allowing the baby to go for other problems arising out of breathing difficulty. There are a lot of benefits of this routine essential newborn care. One is the warmth, which we have already discussed by keeping a dry, warm towel, covering the baby, and immediately drying the baby, and then cover baby's head with the cap to prevent the loss of warmth, so that it doesn't lead to hypothermia. Of course, the mother's skin-to-skin contact is a natural incubator. Prevention of infection by clean cord tie should be sterile, and the cloth that is used to cover the baby should be clean. The hands of the person who's delivering must be clean, and the whole room or the environment has to be clean. So with this, we will be able to prevent successfully the source of infection. Of course, early initiation of mother's milk, nectar from heaven, the colostrum, has all the antibodies to protect babies for the liquid gold and the liquid immune system. I think that will take care of all other infections. If there is any difficulty, we need to assess and take necessary steps. By preventing delayed clamping, I've already mentioned, it can prevent the risk of baby developing anemia. What is a normal newborn? It is time to understand. Any baby who weighs more than 2.5 kg, baby who has completed 37 weeks of in utero life, mother's womb, and then delivered, and baby's weight is matching with the duration of the gestational age. And baby breathes well, which is checked by a score called Apgar score, which is more than 7 at 1 minute, is fantastic that everything is fine. And babies, these are the babies. When we call them normal, they do not have any breathing difficulties, they do not require any resuscitation or any other postnatal problems or any other complications. With this criteria, they are called the normal newborns. What we need to do is the important is, the understanding of prevention of infection is a very, very important criteria. So I'm again reinforcing on this criteria, what is called clean chain of Pancha sutras. So 5 things have to be clean: the hands which are going to handle the baby at the time of delivery, the place where the baby is delivered, the surface, the cord tie. As soon as the umbilical cord is cut, we are going to tie that so that there is no bleeding. So the tie should be sterile or clean, and the cloth in which we cover the baby should be clean, and the blade with which we cut the cord also to be clean. If we take care of these Pancha sutras, majority, more than 90% can be easily prevented. And once we clean that exposed cord with a sterile spirit or the any of these antiseptic solutions, that means it is ensured that the umbilical area is clean. What exactly happens when the baby is born? Please look into this picture carefully. As soon as the baby is born, it takes a deep breath and starts crying. Crying is required to create a good amount of pressure. And then, because whenever we cry in life, during any of the stage of lifetime, we feel it is negative. But a baby crying here is a very positive thing. It cries because the pressure is created for the lungs to open, the balloons to open, and then fill the lungs with the air for effective exchange and start functioning for normal autonomous exchange of gases, so that baby has become self-sustainable through breathing. Then you see here, as soon as the baby is born, this is exactly how the babies look. It is full of amniotic fluid. You see that the mouth is open. They are wearing glove to maintain the Pancha sutras, a clean towel. This is how it has to be immediately cleaned and dried, so that further loss of heat can be minimized, so that the baby doesn't become hypothermic. How to keep the baby warm after the delivery? It is very important. The room should have a comfort zone of 25 to 28 degrees, and all the clean Pancha sutras have to be followed. Preferably, once the wiping and cleaning happens, better to put the baby on mother's abdomen for skin-to-skin contact, and then cover the baby, start breastfeeding. I think things will fall in line very naturally. Nature has designed things in such a way, the rest of the things happen naturally. These are the supporting, steps that are required for the newborn at the time of birth. You see here how to put the baby to skin, because I've used the word. Many of you are interested to know what is this skin to skin contact. The skin of the baby coming in contact with the skin of the mother. You see here, baby is put in between her two breasts, exactly in the cleft, and then see how nicely head is covered and then body is covered with a cotton towel, and you see that baby is comfortable, not crying. It is feeling the warmth of mother's skin as well as comfortable. The baby and mother are very comfortable and very well settled. Baby is doing well, breathing normally. Yeah, what we need to look at after all these things has happened is we need to look at the card care. This is one thing where it is being cut and a clamp is put. Many times the tie or the clamp can slip off and there can be bleedings. Hence, there is a very, very important observation that needs to be done immediately after birth in the first 1 to 3 hours, because once the cord collapses, it can slip off if the tie is there. Most of the time, this clip which is designed is even more safer, so that it doesn't slip when it is clamped properly, as shown in this picture very clearly. So see that the clamp, the cord is cut and then clamp is put, and clean this, the open raw area with a sterile, liquid. Use a sterile instrument, that is the blade or the scissor, to cut this. You have to look for whether there is some amount of bleeding or any oozing, and leave it open in the atmospheric air is more ideal. Immediately ask, the baby is dried, baby is well settled with the breathing, baby is enjoying the warmth of the baby, then cord is well taken care. Then what the next step is, this will take around 20 to 30 minutes. That's why we say always start breastfeeding. The first feed, the best breastfeed is the first breastfeed. So you start this with a technically good attachment. Good attachment is mouthful of breast. The whole of areola should be inside the mouth. Nipple is only a way for transfer of milk from the mother's breast to the baby's mouth. The nipple will not contain milk, whereas the black part, the dark pigmented area behind the nipple is the area which contains the milk. That's why God has made a special color to that area, because that is the most vital area for the next generation. Is the message that the baby has to, all of us have to focus on that area. That is where the next generation's survival, the areola, contains all the milk that is produced by the mammary gland, the breast, will be stored under the areola. So the baby has to take the black part into the mouth and then suck on that part to get the milk. Nipple is only a way to transfer milk. Baby sucks on the nipple, will not get the milk. And baby should be very close to the mother, skin to skin contact. No gap between the mother and the baby is called good position. Here we see the baby is in good position. Baby is also in good attachment. And you see that baby is quietly taking the milk and comfortable. That means baby is getting all that the baby wants, the milk. If the milk is not flowing for any other inadequate or improper attachment technically, baby will cry when it doesn't get anything on sucking. So I have made a small checklist of do's and don'ts for your simple understanding. Yeah, what is that we need to do important is physically and emotionally we have to prepare the mothers. You are a healthy mother, baby is healthy in the scanning. You are going to breastfeed your baby successfully, baby is going, we will ensure, put all our efforts to make sure that mother and baby are both safe. At the end of the delivery process, we will take care of you. As soon as the baby is born, baby should be in your skin to skin contact for all the benefits that have been mentioned. and you will have to start your own nectar from heaven, the mother's milk, God-made food. Then we will help you in making the good positioning attachment. At this stage, I would like to mention, if there is an opportunity for any one of us to create an opportunity for a mother who is pregnant to have a look at the mothers who have already delivered, and these mothers, pregnant mothers, can go and have a look at the technical way of feeding, how to hold the baby and how to offer the feed, how mothers enjoy it and how they are successful. I think these mothers, even before the birth, the expectant mothers will have the success mode in their mindset. I think that's a very crucial thing. Most of the healthcare facility have to focus on this, so that the mothers who are yet to deliver will feel, oh, everybody is doing, I also can do, will be the confidence that they will have. Otherwise, they would have read Google, Dr. Google, all these, books, journals, information here and there in bits and pieces. And so many people would have commented in the neighborhood. All influences the very, very tender mother's mind during the pregnancy. So we need to give the right information. The language should be uniform, whether you speak or I speak or somebody else speaks. Then all these confusions can be definitely minimized. So exclusive breastfeeding in the first complete 6 months till the beginning of the 7th month. I would like to use the word till the beginning of 7th month, because most of the mothers do get confused after the completion of 5 months. Once the 6 months starts, they will start giving complementary foods and other things. No. That is why exclusive breastfeeding till the beginning of 7th month, and then homemade, mom-made traditional foods along with continuation of mother's milk for 2 years is very, very vital. Has to be told at this stage only, so that they are well prepared what to do, how long to do, how well to do. So after that, homemade traditional mom-made foods have to be given from pan to plate, no storage, no role for processed foods or the junk foods. Application of breast milk into the eyes during the neonatal period is a good old traditional, wise practice of our ancestors, so that there never used to be any infection, or if there is little discharge, this mother's milk, which contains immunoglobulins, will take care of this normal thing. We don't have to run around and look for the medicine, because mother's milk is the best medicine. It has all the immunoglobulins, and also the practice of salt to the umbilical cord makes the umbilical cord wonderfully clean. No powder and no other things, gentian violet and other things to be put. These come under don'ts. So no, among the don'ts, no pre-lactium feeds, maybe sugar water, honey, holy tea, goat's milk, processed food, formula feeds. Nothing should be given, because there is a risk of contamination. There is risk of infection. Likely the child may develop sepsis, and it is very, very life-threatening. It can be fatal if it is not tackled at the right time and identified. So the practice of expressing the first milk, the colostrum, thinking that it is a old stored stock milk and it is old one, or maybe it's the spoiled one, is the feeling they express and discard, should not be done. Because the mother's milk gets prepared even when the baby is falling on 8th month of gestation and 9th month, and it changes in its composition as the baby's age varies. That's the beauty of nature and God's gift. So no other supplemental feeds have to be given. Never forget to burp the child as soon as you feed the baby, so that baby doesn't swallow air and pass gas and then cries excessively while passing this gas. No powder gentian violet to be applied to the umbilical cord is another important instruction. Why we need to keep the baby warm? Babies, if the head is open, there will be radiation of the warmth, and the baby loses the temperature and needs more energy, the body mechanisms to produce. Child may be prone for hypothermia. Or if the abdomen is not covered and without any cloth, you put the child on some surface by conduction and some by evaporation, they lose the warmth, and then the risk of hypothermia can lead to other hypoglycemia, the risk for infection, and thereby risking the life, the risk of mortality. The normal body temperature ranges between 36.7 to 37.5 degrees centigrade, and then when we call it as cold stress is when the temperature is below 36.5. Then if it is moderate hypothermia, it is between 36 to 32, and severe is even when it is less than 32 degrees centigrade. So we should not allow this to happen. And other signs, what we can observe as features when somebody looks into the baby can be slightly on touching, it can be very cold, peripheries especially, then it can be looking bluish in color, and baby may look little pale, it will be less active, and a cry also will be weak, child can have fast breathing, are all signs of decreased body temperature, the hypothermia. Body massage is a very, very important traditional practice. All of most of us do. It's a community practice. So generally, the body massage, is started immediately after birth with the oil massage and then with a warm water bath. There are traditional birth attendants who come and do this, and even the experienced grandmother at home or whoever is confident to do this is well accepted in the community. And then this is for only normal babies. So it is believed that it improves the circulation and tone of the muscles. It comforts the baby, improves the mother and infant interaction and the bonding. It improves weight gain and enhances and immunological functions of the baby. It prevents dryness of the skin, and it improves the thermoregulation. Because warm oil is applied and you do a massage, it adds more warmth. Baby's circulation and other things improve. What is the most important don't in this particular body massage for the newborns is do not put oil into the eyes, nose, mouth and the ear, because that traditional practice is there. Actually, it is not correct and scientific, because you put oil into your eyes, you will not hear well. You put oil into the eyes, you will not see well. You put oil into the nose, likely to choke and develop a breathing difficulty, and into the mouth, it is even more dangerous. So these babies, while olden days when it was done, they used to sleep quiet, after this thing, because they were unable to hear. They become dull. It should not be done. And you know that how difficult it is to clean oil when it is sticky to the hand only with soap and all. Imagine if it is deep inside the ear, what can happen? My grandmother used to tell, I have put oil to you, baby. I said, thank God nothing has happened, grandma, but don't practice this, is what I told to my grandmother. So she accepted. If you are telling, I will accept. So we have to change accordingly, scientifically, as we advance towards the recent advances of good practices, proven practices. So the normal features of a newborn, I have mentioned already, the weight is more than 2.5 kg, length generally anywhere between 47 to 52 centimeters, head circumference ranges between 33 to 37 centimeters. Most important is a heart rate 120 to 160 times it beats per minute. A respiratory rate, I have already told, up to 60 is taken as normal without any indrawing or difficulty breathing in a newborn. Urine, we look for passage of urine, it is expected to happen within 48 hours, and passage of stool, what we call the dark color stool, first stool as meconium, has to be passed within 24 hours. Daily routine care. Okay, this is what has happened in the beginning. Then onwards, the first 1 month is called newborn care, and daily routine care involves keeping the baby always warm, well covered with a cotton cap. Traditionally, grandmothers used to prepare even before the baby is born. That's what was the practice. Now, however, now the ready-made cotton caps are available. No need of woolen cloths. Woolen cloths are required in places where there is ice fall or they fall. In our state, I don't think any place requires woolen cloths. If it is well covered with a cotton cap, cotton gloves, full sleeve cotton dress, and a cotton diaper, and a cotton towel in which the baby is wrapped well and close to the mother is more than enough to maintain the normal temperature. And breastfeeding the baby, whether things are going on well, baby is taking well, mother is having any difficulty, pain while feeding, most important thing, the mother can have pain if the baby is not in good attachment, sucking on the nipple will lead to sore nipple, damage the nipple, and the pain starts. Mothers are hesitant to mention about this pain. They are very tolerant, very, mothers are mothers. So it is very important to routinely ask an open question like, do you have any difficulty while feeding? They will tell no. Then the next question generally I prefer to ask is, do you have pain while feeding? Before I end my sentence, the response will be, yeah, ಸ್ವಲ್ಪ pain ಇದೆ doctor, right side, ಯಾವ ಕಡೆ right side, left, ಎರಡು ಕಡೆ. So they will come out with that. So we need to ask more positively and then help them with all the support required to make it a good attachment. The pain disappears, mother can feed more happily, successfully. So that the baby gets successful feeding, which is a very, very important thing. I'm sure our national coordinator, Dr. Arun Gupta, will be doing a justice for that, and he's the right person to deliver the thing. I think I congratulate the team for choosing him because he's one of the person who has throughout life has been working, he continues to work. He's a great taskmaster. Of course, the daily skincare, maybe the routine oil bath, especially, castor oil was used. Nowadays, I recommend only coconut oil because it contains scientifically the medium chain triglycerides, which are going to be absorbed on the skin. Exposing the baby to sunlight will produce vitamin D from that. The bones become stronger and healthier. Of course, the eye care, any discharges is there, just clean it with a clean cloth and put, mother's milk. It should be fine. At the end of every feed, they can put, eye full of 3-4 drops of milk into both the eyes. Most important is umbilical cord care because it is cut and there is a wound which has to heal. So that is the only place which is scientifically exposed raw area, which needs to be taken care so that as the cord keeps on drying, it falls off. Once it falls off, we again need to clean that after giving the like routine bath, clean it, dry it. Then at the end of that, put little salt. No powder. The powder should never touch that area because the powder will absorb the water and it can create a foul-smelling discharge. Hence, after the bath is given, just clean that, put a pinch of salt. That will take care of rest of the things. No powder or anything is required. And it heals by itself wonderfully over 7 to 10 days. Clothing of the baby, I've already mentioned, cotton cap, cotton dress, cotton towel, cotton diaper, fantastic. Then all the measurements have to be taken periodically because when we document what is the measurement at birth and how fast the baby is growing, how well the baby is growing can be measured. And anthropometric measurement at this point are the foundation measurements for further assessment and interpretation. Of course, vaccination have to be followed because babies at this age have not developed well immunity and they need to be protected. Hence, there is role for these vaccines to protect them from these infections around this stage because all the vaccines designed for first year are against the killer diseases for these newborns. It is well planned through the expanded immunization program. This has been planned and all these vaccines are very, very scientific, needs to be practiced meticulously. Of course, a regular follow-up to know all these things are going on well has to be planned. What is important? How to keep the baby warm? See, very beautiful picture where you can see the mother's skin is in touch with baby skin. A nice cap is there, a warm cloth is there, and keep the baby with the mother. See how nicely baby is sleeping and enjoying. That means things are going on well here. Yeah, first bath. You see here, after 24 hours is important. Generally in hospitals, they give a sponge bath and clean it because that all the whatever the vernix caseosa and the white patchy things will be clean. And it is very nice to make sure that the warm water is warm enough to keep the baby warm. This grandmothers know well. I will not tell any numbers, magical numbers to the temperature and all. You see the baby's bath is being given, baby is very comfortable, means everything is, checked and practiced well. Of course, the umbilical cord, see here, it is very clean and dry, almost it is getting dry. In this picture, you see that. So that is what we have to ensure. Sometimes we see that there is some collection, discharge, foul smelling thing, or even if this is fallen, there can be a protruding, pointing structure, what we call umbilical granuloma. You don't have to worry about it as long as you practice drying the cord and keeping it clean and putting the salt, and then it heals by itself. Eye care, this is with a clean cloth. See, there is a gauze. This seems to be in a hospital. Just sterile gauze, they are cleaning the eyes. That is the way it has to be cleaned with the cloth. Then administer mother's milk as required. Changing the cloth, you see that it's a full arm cotton cloth. All of us, these things are available everywhere, but make sure it is cotton cloth and well covered. It is very important to measure the head circumference, the weight of the baby, and the length of the baby as a basic measurement. You see here, generally at birth, it is around 38 to 40 centimeters. Vaccinations for the baby, very important. At birth, we give BCG, oral polio vaccine. Of course, hepatitis B by recommendation by universal practice by World Health Organization, which will make these babies to be protected from the transmission of hepatitis infection from mother to child. Of course, vitamin K has to be given for various medical reasons. And there are few things that we see. The mothers may ask you and me or anybody, what are these? In the right side, you see here the white dot like thing around the nose. And you see here it is there. We call this as bilia. And these are all normal, transient skin lesions, cutaneous lesions. When the baby is in the mother's womb, all these things are, skin also has all these marks. As soon as the baby is born, within few days it disappears. So it is called milia. There is nothing to worry about these white, tiny lesions around the nose and the nose. There are few, black spots you are seeing here. These are called Mongolian spots. They will be present up to 1.5 to 2 years from birth. Then they disappear. Actually, they are bluish in color. Those of you can see a real live baby, you will see, especially seen predominantly over the back. And as the baby grows, all these things will change. There is nothing to worry about. And whenever the baby is, covered with other cloths other than the cotton cloths, there can be some irritation to the skin because they have used the skin unfriendly. You see that the skin reacts with the redness and other things, and then this will lead to all these rashes. But once you change the cloths, it will be near normal. There is no need to use anything. On the right side, this is called erythema toxicum. Epstein pearl, you see here, the arrow mark, the white pearl-like thing. When the baby cries and opens the mouth, it's called arch of the mouth, the palate. There is a white pearl, but nothing to worry. It looks like a pus, but it is not. But it disappears over a few weeks to months. There is nothing to worry. This is also one of the normal cutaneous lesions. Other minor developmental peculiarities can be small amount of peeling of the skin, whether baby is born at 40 weeks or 41 weeks. The mother's liquor in the uterus becomes decreased. Then the vernix caseosa disappears. So there can be peeling of the skin, long nails, and other things. Subcutaneous, these are the medical terminology which I am not going to. Acne neonatal, stalk bites, subconjunctival hemorrhage. Many times, when baby is crying or opening the eyes, you see red patches. Oh, there is bleeding in the eyes. During the birthing process, when the head passes through the mother's birth canal, due to the pressure created and this thing, there can be little bleeding, but it heals on its own, doesn't require any treatment. And some babies may be born with congenital teeth, nothing to worry about it. And some may be born with umbilical hernia. These are all other minor developmental peculiarities. When we plan to discharge, we have followed, we have advised follow. So while planning a discharge from the hospital, better to observe for at least 36 to 72 hours. Nowadays, normal deliveries, once the bleeding is well controlled, they are discharged within 72 hours. They should be free of illness, or baby should be having no risk of jaundice or should not develop jaundice within those 3 days, depending on the blood compatibility or incompatibility. Mother must be confident about successfully breastfeeding the baby, should have received the at birth vaccines like BCG, OPV, and hepatitis B. Child has passed, newborn has passed urine and meconium should be confirmed just to see that things are normal. There are no other problems. Then review within next 48 to 72 hours so that if there is jaundice, we can identify. If there is any feeding difficulty, we can help. Or if the child's activity is not good, we can identify whether there is a foci of infection to identify and start treating them quickly, and a regular follow-up for growth and development assessment. I'm sure the rest of the topics covered subsequently, and tomorrow we'll be covering all these details. There are some harmful traditional practices like use of cow dung, mud application, and umbilical cord. Nowadays it is less, but this was the practice that was going on. These are harmful practices. Immediate bathing without allowing the baby to stay, stabilize. Use of other prelactial feeds, application of kajal in the eyes, installation of oil into the nostrils and ears, introduction of artificial feeding, diluted milk, etc., or administration of expensive formula feeds. What are some danger signs when they are going? It is important for us to tell them when you have to come back. What are not good signs? What are signs of the baby is not doing well, not feeding well, less active, peripheries are cold, fast breathing, grunting, making some sound, moderate to severe chest indrawing. Then child has a staring episode and shaking the limbs, convulsions, or it becomes stiff, puts the body tight and stares, or it's going to be very flaccid and floppy. Temperature must be more than 37.5 degrees centigrade, and umbilical, if it is more than 37.5 and less than 35.5, both are warning signs. Umbilicus draining pus, or you see there is any bleeding or any redness around the umbilicus is also a sign of infection. Any pustular lesions, pus-like, pearl-like pustule containing, pus containing blebs are seen, more than 10, what we call them as bullae or pustules, or swelling or hardness and redness of the skin anywhere, or any bleeding from the stumps has to be looked into. This is a checklist. I think I have covered all. Those of you are interested, it is available on the net. Please go through the checklist to say minimum these things have to be looked into. Date of birth, time of birth, examination, feeding started or not, whether it is babies crying, the feed is taken well, crying well or not, etc., etc. This is to make sure that the checklist I am talking is because everybody start doing this. Okay, minimum these things you have seen and you're not going to miss is the greatest help that we get from this checklist. So,
You can.
key messages. I have come to my last slide now. Take home messages are this. Most of the neonatal deaths occur during the delivery or on the day of birth. Low temperature can be prevented by immediate drying and keeping the baby in a dry cloth and start putting the baby for skin-to-skin contact, the kangaroo mother care. And both should be covered well with a cap, baby with a cap. Initiate immediate breastfeeding so that energy is sufficient, there is no low glucose level and hypoglycemia can be prevented. Vitamin K to prevent all other bleeding diseases during the newborn period. Exclusive breastfeeding up to beginning of 7th month and can be continued, not can be, up to 2 years at least and beyond, possibly 3 years. And after that, start traditional homemade, appropriate, adequate, mom-made, nutritious, affordable, feasible, accessible, sustainable principle to be followed and can be given. And that ends my presentation about the normal newborn care from antenatal to starting the complementary period. I have covered the principles. Those of you have any questions? I think
Thank you so much, sir, for your very clear presentation. And my thanks are also due to you because as you have completed your presentation on time. Thank you so much.
Yeah.
There are some few questions that has been posted in the chat box.
Yeah, please.
Together, the first question was on how to take care of a baby, a premature baby.
I
As
think
we have
there is.
seen only about the normal babies, one question is being asked on premature baby.
Yeah, the question is very relevant. That's why I'm telling I'm talking only about normal newborn. I'm sure somebody else is talking on low birth rate, preterm and high risk baby. Anyway, I will answer. The principle of whatever I have told for a full-term baby remains same. Taking care of the temperature, airway, breathing, covering. But those babies who need oxygen, oxygen needs to be started. Baby is not feeding, then express the milk and feed. Baby needs any other complications like any infection or anything, we need to start antibiotic. And baby requires definitely NICU admission if it is 32 weeks or less or 34 weeks or less. This is in summary. Yeah.
Thank you, sir. And the next question is about the C-section mother. What's the major area of care for a C-section mother?
Yeah, C-section mother, you have now entered the domain of C-section mother's care from baby's care. No problem.
No, it is even about the baby's care who's born with C-section.
No problem. I have shown my picture where the mother has put the baby in between the breast and cover like that. Baby will start taking the feed. Mother will be lying like that, looking at the roof. Mother is a passive agent. The rest of the job is done by the baby. And one family member or the hospital staff will support the mother to handle the baby and then support the baby. That is all is required. Otherwise, temperature, covering the baby, warmth, feeding, all of the checking for respiratory rate, weight, everything is same. The additional point required is the technique of feeding in a C-section mother, then how to help this mother and support. That is the only additional point.
Thank you, sir. Thank you. And one question is also about the importance of vitamin K for a newborn baby. Why is it so important?
Correct. See, the baby when it is born, the body system is not still functioning. I use the word autonomous, it becomes once it comes out. The once baby is born, the intestine and all is still not started functioning. What we call the normal bacterial flora is well not established. Once the feeding is started, then the intestine and the flora starts working, what we call colonization. Then these good bacteria and all will help production of vitamin K within the body. Before that, baby will not have vitamin K. Vitamin K, of course, you know, it is very important for the breeding mechanism to work normally. That is why it is given. Only at birth it is given. Afterwards, it is not required because the body starts producing vitamin K. That is the scientific reason. Any other
Thank
questions?
you so much, sir. That's all the questions has been that are.
I thank my dream university, Mysore University, because I studied from St. Philomena's, Mysore. I'm a student. I always dreamt of doing my MBBS degree from Mysore Medical College. Anyhow, I studied. Even now, I am very, very fond of Mysore, the heritage city. Thank you all for giving me the opportunity, and all the best for your very strategic, very important program to bring awareness among all these people to further improve our knowledge, not only knowledge, and we have learned so many skills in our sessions to be practiced. Unless the skill transformation happens, we are not going to achieve the knowledge is enough. Google everywhere, but unless we transform this knowledge into the skills, we are not going to achieve much, is my message to all the audience in the August gathering here. Thank you, madam.
Thank you so much, sir, for your vivid presentation, which focused on the essentialities of carrying a newborn. The presentation was as per the words of John Dewey, who said, education is not preparation for life, education is life itself. Though each one of us are very much aware of the care of newborn, the presentation had intensely portrayed its intricacies. Hope the deliberations on daily routine care, benefits of newborn care, do's and don'ts of feeding practices, importance of warmth for the mother and the child, harmful traditional practices, danger signs of newborn, all aspects had enhanced the knowledge of the listeners on the same. Thank you so much. Thank you.
Good day. Should I stop sharing the screen? Sharing the screen.
No, sir, repeat.
Thank you, Dr. Aranthya Maraisavihan, for moderating the first scientific session.
Okay, next.
The second scientific session focuses on breastfeeding, current practices, policies, and programs by the resource person, Dr. Arun Gupta, Central Coordinator, Breastfeeding Promotion Network of India, Regional Coordinator, IBFAN South Asia, New Delhi. I invite Dr. Shobha Ji, Associate Professor and HOD, Department of Human Development, Srimati BHC Central Institute for Home Science, Bengaluru, to take over the second session of the day. Over to you, Dr. Shobha Ji, Madam.
Good afternoon, everyone. Wonderful session by Dr. Mallikarjun, sir. It was a pleasure listening to you, sir. Thank you for giving me this opportunity to introduce our next speaker and the moderator for this session. It is said that a pair of substantial mammary glands has the advantage over the two hemispheres of the most learned professor's brains in the art of compounding a nutritious fluid for infants, says Oliver Wendell. Yes, our next session is on the elixir of life, breast milk, and we have none other than Dr. Arun Gupta, Central Coordinator of BPNI, Breastfeeding Promotion Network of India, speaking to us about breastfeeding, current practices, policies, and programs. And I have the privilege of introducing this illustrious person. Dr. Arun Gupta, a pediatrician in public service, founded the Breastfeeding Network of India, BPNI, in 1991. Over nearly 30 years, BPNI has played a key role in strengthening national policy to promote, protect, and support breastfeeding, which has led to almost negligible growth of breast milk substitutes. He has also written extensively on child abuse and conflicts of interest, and in 2015, nutrition advocacy in public interest. The group works on issues like ultra-processed foods, and Dr. Gupta has worked on policy analysis related to breastfeeding and complementary feeding. Part of this work involved conceptualizing and creating IBFAN's World Breastfeeding Trends Initiative, a breakthrough tool to bring together key government, academic, and NGOs to identify gaps and generate action. And it has created a unique web repository of policy and programs. His strong belief in the legal frameworks to protect public health has made significant impact in countries. And Dr. Gupta coordinates BPNI and the South Asia part of International Baby Food Action Network, IBFAN, which is a 1998 Right Livelihood Award recipient. In 2001, Dr. Gupta was named a Fellow of Indian Academy of Pediatrics. He is currently a member of the WHO's Global Development for Guidelines on Complementary Feeding. A person with such great accomplishments and achievements. And we have Dr. Arun Gupta talking to us and enlightening us about breastfeeding, current practices, policies, and programs. Over to you, sir. It's been my privilege to introduce you to the gathering and be the moderator for this session. Welcome and kindly take over, sir.
Mysore University as well, and personally, I'd like to thank Shobha for introducing me. And I will not, so can you see my screen? And yeah, everybody can see my screen?
Yes, sir. Yes, sir.
Okay. And then I'll take my time, say about 40 minutes, you have said. Is that right? All right. Okay. During my presentation today, I'll talk about, I'm thankful for a wonderful first session, which Professor Mallikarjun has conducted on the overall newborn care, where I like to, put a part of it, which is a very critical part of newborn care, which is early and exclusive breastfeeding. I'll talk about status of breastfeeding as the topic suggests, and how the policies are supporting in our country, and then where are we? I will particularly lay more emphasis on the steps needed in the hospitals right at the time of birth, which actually make or break breastfeeding, which is critical for the newborn babies. So, in the end, I'll share some of the uh, possibly the audience people who are from the nutrition community or from the other domains, students or teachers. So what you can do as individuals. So to be a little more practical, I'm not going to take a load of recommendations to the government, but to, to you as individuals who are currently. So you are free to write questions in the chat box now during the presentation as well as in the end, whichever is suitable. So welcome everybody. Thank you for coming. Thank you for your time to listen to what we are saying today. And I'll quickly go into the technical part of the presentation. And I'm sure now first point I want to make is that you count on the first 5 years of life, right? These are the first 5 years of life. This is important to take note. This yellow graph actually demonstrates that these are the baby when the babies die the most in our country, which means if there are more than 1.2 million, 12 lakh babies die under 5 years, out of that about 9.5 lakh die by the year 1. So first year becomes very critical. And out of that, even 6.9 lakh, they die during first month of life. So that's an important point to note, that around 70% of deaths of babies, of infants, they are during first month of life. So that becomes very clear. Now, second most important part of our life, which actually maintains good health, is nutrition. Now look at this. Undernutrition, it actually strikes in first year of life. So around about third or fourth month of life, it begins, and then you already have 26.7% babies at 6 months of age who are underweight. So this is something important to take a note, because a lot of babies are born low birth weight and they are like so that's why we are very large number of babies at 6 months, they are underweight. Then it goes to about 33%, then about 37% by 18 months and 2 years. And then relatively, it's a bit of a flat curve. So this is how the curve of the undernutrition. It begins here. It then, its first 2 years is, I would say, is most critical. In some states, it flattens even earlier than that. Now, the third important aspect which happens during this period is this graph of brain development. If you kindly notice, there's first 70% of the brain develops during around 70% during first year, and by 90 to 95% during second year of life, and rest of the 4% in all the later life. So everything which happens during first year or earlier than first year, that is pregnancy, is very, very critical if we want to maintain good nutrition, if we want to maintain good health for our babies, and if we want to maintain good development, better IQs for our population. So this is the fundamentals. So this slide I brought up, I've been using this for ages, but I thought it is important that everybody should be aware of the broader implication of it. Why essential newborn care and where we fit in it. So there are several elements. I don't want to get into detail, but one of the elements is early and exclusive breastfeeding. Early means during first hour, skin to skin contact, and exclusive means nothing except breast milk during first 6 months, of which first month is so very critical. So this is the key according to me in terms of both health, survival, and development. According to the Ministry of Health, Government of India, this is a slide courtesy Ministry of Health. If we follow these practices, it prevents 20% of newborn deaths, 13% of under 5 deaths, 11 times lesser chance of having diarrhea in these babies, 15 times lesser chance of having pneumonia in these babies. IQ points go up by 3 points. Prevention of non-communicable diseases like diabetes, cancers, lesser hospital stay for newborns. Those who get sick, they don't have to be hospitalized a lot. And of course, maternal benefits, which I already said about prevention of cancer, uterine and ovarian cancers in the mother, as well as diabetes type 2 and obesity, which is a very important factor. Why this happens? Because the mothers who they transfer these antimicrobial factors. I will not get into the details. They get into as antibodies as well as live cells into the breast milk. And if a mother gets infection, for example, if a mother has urinary infection or lungs infection, she produces antibodies. They transmit through the breast milk to the baby to protect the baby. So this is how the proactively. Now, why we are worried? As I already said, the Government of India's data shows 20% reduced mortality, and it is backed by studies. So this is a study from 2007 in which it was found that if the risk of death in newborn period is 0.7 in babies who start breastfeeding within 1 hour, it increases as we delay breastfeeding. So it's from 1 hour to 1 day, it's about 1.2, then it goes into 2.3, and after day 3, the risk is 4.2. It means 6 times higher risk is there. Similar research again proved the point in 2016. This is a large study and published in the Lancet, in which if we the study looked at if the risk was 1 below initiation of breastfeeding below 1 hour, it increases to 1.9. So it doubles the risk if the child is delayed initiation beyond 24 hours. But this is a serious matter. I'll talk to in detail why we are talking about this. It's not just that we don't know about this, but the problem lies in whether our mothers are able to breastfeed or not. Several other studies have proved a lot about how much is the impact of inadequate breastfeeding. So 34 million cases of diarrhea, 24 million cases of pneumonia. Additionally, if you continue with inadequate breastfeeding, and it prevents about 100,000 deaths in India. These are the calculations done from a latest international study, which have done provided a tool for calculations. 40,000 cases of obesity can be prevented. So 8,000 cases of breast cancer, about 1,700 cases of ovarian cancer, and 87,000 cases of type 2 diabetes. So this is the benefit to the mothers, and it's a healthcare cost which can be saved more than 700 crores. And this is overall cost, which costs to the households if the babies were to be formula fed, including not only the formula cost, but the time cost and the opportunity cost, including. So we lose a lot, 25,000 crores or something. Now, what is the status of policies which make a woman successful or fail breastfeeding? Now, this is an important point which I will not get into the detail, but you should be aware of. So these are the 10 parameters on which we measure breastfeeding policy. So whether there is enough national coordination or not, the indicator is in red. Baby-friendly hospital, which I am very worried, I'll talk in detail about it today. I think it draws 0 out of 10. We have a good law to protect breastfeeding. Maternity protection, still we need to improve a lot. Health and nutrition care system, we are improving. Mother support, information support, infant feeding during HIV, we are doing some work, but we are very poor at the infant feeding during disasters. We don't take care of mothers and babies during disasters. Similarly, in monitoring and evaluation, we are doing something, but it's not. This report is available on the website. You can go to World Breastfeeding Trend, WBTI. I'm sure you can find the country repository. All the reports for the last 15 years are there. Now, what is the status of breastfeeding practice? Because we have weak policies, and there is no improvement in last 15 years. The point here I want to make is this, that the breastfeeding practices are not as good as we would like to be. Now look at the exclusive breastfeeding. It falls from 72 to 41 by 6 months. It means at 6 months only 41% mothers are able to practice exclusive breastfeeding. It should be somewhere here, but 70 to 80%. But why? Because they are not supported. It's not the fault of the mothers. It's not the fault of the families, to my mind. It's the fault of the system. It's the fault of the environment that does not enable them to breastfeed adequately. So at 6 months, it means 60% of the babies are getting mixed feeding or getting artificial feeding, which might be powder milk or liquid milk, whichever, but they are on artificial. How it is get disturbed is like, you look at this graph, the 1 in 4 babies, they are getting water, which is not required during exclusive breastfeeding. Then about 14% babies, they are getting other milks during first 6 months. This is another problem which I think we need to tackle. Now, if we look at the trends, how breastfeeding rates have you? Let's say initiation of breastfeeding within 1 hour, which we are really bothering in today's presentation, because we are talking about newborn care. In NFHS 1, it was 15.8. It grew to 24 point in NFHS 3. And in NFHS 4, it is 41.6. And it might be 50 plus now, we don't know. But NFHS 5 is the indicator. Similarly, breastfeeding exclusively also has marginally improved. Complementary feeding after 6 months has even declined. Bottle feeding has shown a little rise in the past 10-15 years. So this is what probably related to urbanization, women going out to work, hospitals not doing their job. All these 3 things contribute to increased unhealthy diets among our children below 2 years of age. Now this, I don't want to continue to detail this slide, but want to show that there is a wide variation among states, right from here to Uttar Pradesh, the lowest in early breastfeeding is 25%, and Goa has the highest in early breastfeeding in 73. So it means that there are states who are above 50% is possible, but is still not adequate. The early breastfeeding, why I'm saying this not adequate, look at this graph. When our institutional deliveries can be near 80 to 90%, why should our breastfeeding rate within 1 hour should be 41%? It means we are not able to support 1 out of 2 mothers. There are several reasons for this. I'll talk in detail when we talk about the barriers. But this is a clear deficit in India's policies and programs, that only 1 out of 2 mothers is supported in the health system to start breastfeeding within 1 hour. Trends of exclusive breastfeeding are no different. They do differ in states, and national average is about 41%. There are states which have improved after NFHS 3, but there are states which have also shown a decrease in after NFHS 3. If you see, the red graphs are NFHS 4 and Blue graphs are NFHS3. So there are several states here and here which have shown decline of exclusive breastfeeding, which is not a good sign. Where are we today? How do we support our women? Now I'm getting little closer to the hospital. So I'll also share the findings of a World Bank study. And let me just quickly go through these slides. So WHO actually in 1993 gave this program called the Baby Friendly Hospital Initiative, which defined 10 steps to successful breastfeeding. I'll talk in detail about these steps. These have been revised in 2018 and a new guidance has been issued. Based on that, Government of India has already launched in 2016 a program called Mother's Absolute Affection MA program, in which there are 4 components: awareness generation, health facility strengthening, training of health workers, communication, community intervention like sensitization of ASHAs, and monitoring and awarding the hospital which do the good job. We did an analysis of this. It's available on our website, the detailed analysis of this, analysis of 10 steps. And we also did a study by one every step. This is the detail which I will draw your attention to. I'm sure you can relate, some of you can relate it to, as well as some of you can pick up your point which you want to work on. And maybe first is what is the policy? So there is a law in India which bans the promotion of baby foods. So our implementation is weak. Do we have a written policy routinely communicated to all staff and parents, which is missing component? So we don't tell anybody what is our policy. We assume everything. People say, oh, we are doing good in our hospital. Something is very good here, but we don't communicate in writing. What is our policy? Then our monitoring and data management. We do not keep any records in the hospital when the baby started breastfeeding. We do not keep records in every hospital. What I'm saying is every. I'm not talking about surveys here of breastfeeding, NFHS. I'm talking every hospital where a mother delivers does not keep records why formula was used, if formula was given to the baby, what made it, what was the indication. All these records are not. This is the study which we did for the World Bank study I'm mentioning. Now, how do we bridge these gaps? We need to get our civil district officers authorized to do this work and draft a standard policy on BFHI, and every hospital should actually communicate that policy to every mother, and it should have at least 4 indicators to measure, which is early breastfeeding, use of formula, when the breastfeeding started, and how the baby was discharged at the time of the discharge, whether it was on breastfeeding or not. Number 2, indicator number 2 is, step number 2 is staff competency. Do we have a competent staff in the hospitals? Answer is no. So we have inadequate training, limited support is available to mothers, assessment. That's why we are 41% out of 80%. That's the reason. So that's why we recommend that these hospitals should build up their staff capacity. And if some of the hospitals are doing good work, it is probably a drop in the ocean yet. We have been working for last 3 to 4 decades, but we have still to reach a stage where we could say every hospital in India, now I'm told there are about 20,000 government hospitals, that more than 20,000 private hospitals where the babies deliver. So this is something important for those hospitals to do this, to develop a time-bound plan to ensure that lactation support staff is made available. Step 3. Do we talk about breastfeeding during pregnancy? What will with the mothers? What are you going to face? No, we don't. Some mentions are made by ashas in the field that breastfeeding is good. Now, the point here is not breastfeeding is good. With every child or a adult or a old person, everybody knows breastfeeding is good. No point telling people that breastfeeding, you breastfeed because it is good. We need to give those skills. So only very few mothers get talked about counseling on breastfeeding. When we interviewed about 150 mothers during this study, and we found this is a huge gap, and we are, very disappointed with such as care after birth. Now, immediately after birth, Professor Mallikarjun was also saying that there should be somebody available at the time of birth. Now, this person, health worker, trained health worker should be available. But this system is weak in our hospitals. I think whether it is a cesarean delivery, it is a certificate to failure of breastfeeding, barring few cases where personally people are taking interest. But in general, mothers are pushed to give formula feeding because they are told that you can't breastfeed and because you have a cesarean. Supporting mothers with breastfeeding in the hospitals. I think during the hospital stay, again, very weak support to mothers is given. Formula comes very easy if a mother feels, that she has a problem. People can't solve those problems, and it went on to step 6. We should not give any supplements during hospital stay. But there is no check on the use of formula. Private hospitals or government hospitals, there is a bit less cesarean sections, as I already said. When mothers feel that they are insufficient, doctors believe that milk is. Yesterday, a doctor put a video on the YouTube saying, when the milk is insufficient, you give the following form, which formula you give. So people have started now discussing which formula to use. Assumed that women don't produce enough milk without realizing that this is something which they can do if they are supported well. There is no dearth of production of breast milk. It's a question, how do we support mothers? Step 7, babies should be kept together with the mothers. They should not be separated. Ideally, they should be in the same bed with the mother. So that's an important thing that we should also, again, they should be there day and night. The hospital policy should support. If a mother is sick or a baby is sick, they should also be staying together. Responsive feeding. So babies tell us how, that they are hungry. They give us cues. So we should follow those cues. Such cues should be known to health workers as well as they should be taught to mothers. We don't currently bother about this is about competence of the staff. So risks of formula feeding. Very few mothers know about risks of formula feeding. So we don't inform the mothers. So this is an important thing again to remember, that there is an important point that we need to inform mothers. Even if they choose to give formula, we should make it safe. We should help them that how to keep it safe. How many minutes they can keep the prepared formula in the bottle. If the bottle full of milk is lying, many bacteria can grow in it and the babies become sick. This is a particular problem with use of powder milk. Powder milk has inherent contamination in it, which is very important that they should be informed about how to make use of this in case they are using. As I already said, a lot of by 6 months, 60% mothers are giving. We should ensure that they are giving it safe. Lack of systematic follow-up. So when we discharge the mothers from the hospital, we do not follow up for breastfeeding. We only talk about treatment things. So many times you take this drug, that drug, report to the doctor. We talk about, at the most, we talk about vaccination. We rarely talk about you come back for a visit for checking on breastfeeding. So that continuation is important, and referral is important, whom to meet if she has a problem. So these are the 10 steps which I want one by one, I wanted to talk to you in detail, and they raise many questions, which further lead to what people can do, what people cannot do. What are the challenges? Now, in the World Bank study, the most important challenge was cited that the pediatrician said the time is most important factor, and if there is a dedicated counselor, it makes it easier for the doctor. After seeing 100 patients in the OPD and after taking rounds of 50 beds, it is impossible to do counseling. This is right. That's why we recommend that we should have women who are graduate women who can be given lactation training, be available, be employed. That should create a new employment in the every hospital. These 40,000 hospitals have lactation counselors who can be dedicated this work and help mothers to. Which are the typical barriers which I was talking about? So, employment is a barrier, no doubt, but if we can support mothers at the work, we can bridge this barrier. Cesarean delivery. I think the assumption that cesarean mothers cannot breastfeed is wrong, and we should try and support these mothers. When initiation of breastfeeding is delayed after 1 hour, it fails breastfeeding exclusivity also. So that's an important point which we should remember. Rest of the things I've already talked: inadequate skills of health workers, lack of counseling during pregnancy, use of prelactal feeds like giving formula or water or anything else to the baby before birth, and use of infant formula. WHO has a list of indication when formula should be used. Breast milk substitute, particularly the powder milk formula, I think nobody is following that. What you can do. Now I'm coming to some of the steps which I'm now directing those to individuals who are listening today. If you are interested in changing something, environment around you, a hospital near you, or a family member who is pregnant, you can reach out to her, or a family member who is breastfeeding, you can try and see how you protect breastfeeding. Now, a couple of things which I'm just listing here. I'm not sure that all of this you can do, but it's your choice to pick up. Awareness on the IMS Act, which I'll share with you some posters, which you can see what is not allowed. Promotion of the baby food should be not allowed. Spread the knowledge of how to be successful in breastfeeding. So you all of you should learn about the hormonal control. On BPNI website, there's a lot of information about this. You can go there. If you have not learned so far, the hormone oxytocin and prolactin control lactation, not anything else. So you need to understand how breastfeeding can be successful. Promote skill counseling, I've said it enough. Talk to the hospitals to implement all the 10 steps which I've listed. If a hospital near you delivers babies, please go and introduce 10 steps to them. That this is important for the health of the hospital. They will get less sick babies. I don't know whether they like this or not, but you can try. You can also use guidelines for parents. These are available in 9 languages from the BPNI website, which is a small booklet which women can read during pregnancy and make their own decisions about out breastfeeding or anything else they want to give. This QR code can lead you to the breastfeeding site. You can also download an app called Stanpan Suraksha. It's available in Google and Apple Store. Here you can, if some mothers need the support of a lactation counselor, so these services are made available on this. Secondly, if a baby food company is doing wrong things, you can report it through this app. So these are the 2 key things which you can take care. That if somebody needs help with lactation, you can go to this app, download this app, register, and ask a mother to seek a counselor. You can go, there are authorized counselors, more than 40 counselors available on the app, so you can fix up with them. This is a book I was talking about, Breastfeeding and Complementary Feeding, a guide for the parents, which is available in several languages. And this QR code takes you to that. So lastly, I'll just quickly show you some of the posters which you can make use in your work. Advertising of baby food, any type of promotion like Lactogen, Similac Advanced, NAN Pro is banned. Promotion and display of baby foods in the hospital, clinics, and chemist shops is banned. If a company offers incentives such as free samples, gifts, tied up sales, discounts, it is banned. Sponsorship of any health workers and their associate health worker, by definition, any person who takes care of mother and child, whether is an ASHA or a nutritionist, who takes care of the mother and a child, is a health worker. Their associations or themselves, it is banned for any sponsorship. Now, these companies like Nestle, Abbott, Danone, Mead Johnson, Medela, etc., please avoid any linkage with them. Commission on sales. These companies cannot put a commission on the sale that if a representative sells more, he gets more money. This is also banned. So, this is my final request to you. All of you in your life, take a decision wherever you are. Please don't accept, say no to sponsorship of by baby food and feeding bottle companies like Nestle, Abbott, Danone, Mead Johnson, Medela, etc. in your associations or in your personal work. Thank you very much for your attention, and I look forward to your questions. And let me know if there are any questions. You can write to me later also. And at BPNI, you can send an email to bpni@bpni.org. Thanks a lot. Over to the moderator, please. Hello?
Oh, I'm so sorry. I was on
Please
mute.
unmute, yeah.
Yes, sir. Yes, I'll come again. So that was a very exhaustive and a very effective presentation on breastfeeding current practices, policies, and programs. Dr. Arun Gupta has highlighted the status of breastfeeding policies, programs, and policies and practices. Apart from that, the gaps have been identified very well by Dr. Arun Gupta. The action plan for the same is very effectively suggested. Sir, with substantial evidence and research findings, you have shown us and spoken about the importance of breastfeeding. When you told about only 1 out of 2 mothers is supported in breastfeeding within 1 hour after childbirth, it is something which each of us have to really look upon and take action about that. It's quite disturbing. The MA program, which you were talking about, the 10 steps for successful breastfeeding, and the apps you were mentioning about, the posters, all these will definitely help our health practitioners, students, the postgraduates, the research scholars to work in this very, very important field. Let me just look at the questions if there are any. It was a highly beneficial session, sir. I'm sure the information that we have taken from you will be put into practice by the people organizing the seminar and by the audience.
Wonderful.
Dear audience, your questions will be happy to take it and pass it on to our presenter anytime, and kindly make use of the guidelines sir has given, the different sites and the apps Dr. Arun Gupta has given. I think action is very, very important, but definitely we enjoyed and liked the presentation immensely, sir. Thank you very much.
Thanks a lot for your attention, and I'll send the PowerPoint presentation through email, or if it is larger, I'll send that to Dr. Komala's email, which I have, and feel free to use it, share it, whichever way any person in this room wants to.
That's really very sweet of you, sir. That's really nice. Thank you once again from all of us.
Thank you, Dr. Shubhashi ma'am, for moderating this session. The third scientific session spotlights the early nutritional intervention for infants and young children by the resource person, Professor Jamana Prakash, former faculty, DOS in Food Science and Nutrition, University of Mysore. I invite Dr. Anita C., Assistant Professor, Department of Food and Nutrition, ASOU, Mysore, to moderate the last session of the day. Over to you, ma'am.
Yeah. Thank you for giving this opportunity. Indeed, this webinar is challenging, where it is the need for the hour, wherein we have got many challenges that we are facing, both from the neonatal care to the infant, and even in continuation of it also. So definitely this webinar is will be very informative, and our eminent speakers have spoken about the essentiality of the care that has to be taken, not only for the newborn babies, but also in continuation, how important is breastfeeding, and why it is important also was highlighted by our eminent speaker previously. In continuation of that, I think we have to talk about something of the nutrients, which is also important, not only for the newborn, it is continued even for the infants as well as children. Now this hour will be dealing with the nutrition, that is in the early nutritional intervention for infants and young children. And it will be done by our own beloved teacher and mentor, Professor Jamuna Prakash. And I feel honored to introduce Professor Jamuna Prakash. She, being an alumni and put in with more than 25 years of teaching in University of Mysore, now presently serving as visiting professor for International Union of Food Sciences and Technology in Vietnam, and Department of Food Science and Biotechnology in Shanghai Gongshang University, China. Apart from this, Madam is a fellow of IUFAST and National Academy of Agriculture Sciences. She has to her credit more than 250 research and review papers, 20 books and book chapters also. And along with that, more than 400 research papers of hers has been completed and presented, and even the research and educational projects have been completed with a total citation of more than 4,200. Madam has guided many students for doctoral as well as postdoctoral research, and added to her credit, she is also a recipient of Dr. Rajamal P. Devdas Memorial Award for her outstanding contribution in the field of applied nutritional sciences, and Best Postgraduate Teacher Award, and also Professor M. Vishwanathan Honor Award for Research Achievements. Presently, Madam is engaged as editorial board member of 26 book volume series on nutritional and health aspects of traditional foods of different countries being brought out by Elsewhere Publications in association with Global Harmonization Initiative. Apart from this, Madam also has, I'll take this dais, I would like to thank Madam for her immense support to our university also. And along with mentoring our student, not only as also our student, she has a title of Annapurneshwari to our students. So I'm very happy that I'm introducing our beloved teacher, Professor Jamna Prakash Madam. Madam, welcome you to this session, and please take over the session, Madam. Thank you very much.
Hello, can you hear me now?
Yes, ma'am.
Okay, yeah, because the host had to unmute me. So, namaste to all. Thank you, Anita, for that very nice, eloquent introduction, though I don't deserve so much of it. Dr. Asna and Dr. Komla, I think my colleagues, it's always nice to get back to department because I have very fond memories, and anytime I talk to anybody in the department, it's like getting back to the family once again. So thanks for inviting me here for this webinar. And it's nice to connect again with the students. So all the participants of seminar, I think the topic chosen is very timely and very nice because we are really battling with the child malnutrition in the entire country, and it's been a cause of concern that with all the efforts which are being taken by the government, we are really not reaching any milestone. So we've been examining these issues, I think, from the academic part, from the scientist part, from the medical part, but still looks like we are way behind. So based on this premise, I would like to share my screen. So you need to just give me a minute. Can you see my screen now? Can you see my screen now?
Yes, ma'am. Yes, ma'am.
Okay, thank you. Yes. So now starting with this point where nutrition is really, really important, what can we do for early nutrition of the child? I think the most important part was breastfeeding and the complementary feeding. A part of which, not a part of it, I think almost whole of it was covered very adequately by two previous speakers, and they have done a very good job. So my job would be to just reiterate that and maybe include little more regarding the early nutritional intervention part. So the structure of my talk would be, I would just start with the early nutrition, the starting point, and global nutritional challenges, just a small bit about it, not really too much, because I think already statistics have been presented. A bit about early growth and nutrition to put the placement of nutrition in proper position. Essential nutrition actions, what are the benchmarks given by WHO, because that's what something we all take it. Then most of my talk would focus on the next part, which is the nutrient requirements and the complementary feeding part of it. The practical implications and guidelines for the complementary feeding, the role of fortification or supplementation, and complementary feeding and the later outcomes, the evidence-based observations, because here I have included some developmental aspects, keeping in mind that we do have a lot of students from human development background. And this talk is mostly based on the recommendations, the guidelines, and the science-based observations which are related to early nutritional intervention. The first part, the early nutrition. See, the question arises, how early? This I have taken from Koletzko, who has done a lot of work on the early life nutrition problem. So he says that early life nutrition is one of the most significant determinant of development, function, and future health of all organ systems. Just look at this, all organ systems, and a major factor in both risk and prevention of non-communicable diseases. This is something I would press on again and again, because this is where the importance of early life nutrition comes. So I said, early life nutrition, how early? What do we consider as early? Does it start with pregnancy, birth, postnatal, after 6 months, or after a year, or during childhood, or preconception? See, this is what all these, because when we say early life nutrition, it is not just we are talking about infant, but we are talking about so much more than an infant. So we are going back to the mother, and we are going back to the preconception stage of the mother. That's where the nutrition has to start. And very rightly, it's been said that the first 1,000 days are very important. So this was being called as window of opportunity, and especially during the last decade, we had a lot of evidences which came forward to support the importance of window of opportunity, because this is the most critical time which has a positive impact on a child's cognitive and physical development. Because we know that for good nutrition is, again, it's something like a foundation for all child's future development, whether it is cognitive, motor, social skills, whatever it may be, even the school success. In case due to some reason this is restricted, if the child does not get enough nutrition, there is a nutritional insult, then what will happen? All these early life skills, they are hampered. There are going to be neurological problems, poor school achievement, so cognitive development is affected, and then it leads on to low skilled employment, poor care of their own children. So here we are talking about generation to generation, the problem is going on transferring from one to another. So we are creating a cycle. Okay. And now we also recognize that nutritional factors are very important for many modern and all these NCDs. Okay. Evidence shows that exposures in pregnancy and the early postnatal period, it can modify the gene expressions and the disease risk. So very well known as Barker's hypothesis now. And these early nutrition-related insults, it can be fetal and infant malnutrition, they contribute to the later diet-related NCDs. And both low birth weight and stunting, they have been linked to these adverse risk profiles. So just to again say that nutrition in the first 1,000 days is very important for the health and development. Okay. That is one part. But now dietary patterns, they are associated with the rise in, when you see the next box, later onset NCDs, heart disease, hypertension, whatever it may be, diabetes. This is at a later stage when a child becomes an adult. But you see here, these are also related to early onset NCDs, which are these allergy, autism, mental ill health, and morbidities related to childhood obesity. So it's right from the beginning that we are going to have problems and not only later. And the root cause of these abnormalities which might occur are said to be inflammation and immune dysregulation. Actually, allergy is supposed to be one of the most early measure of any kind of this environmental change on the developing immune system. And nowadays, the evidence shows that the children are becoming more and more allergic, or they show symptoms of higher allergic diseases. How is this mediated? What is the cause for this? See, the dietary patterns, they actually impact microbiome. Now we know that human beings carry a lot of microbes in the gut. They're supposed to be around trillions, much more than the number of cells also. So now this is related to the bacterial species abundance, the type of bacteria we have in the intestines, in the microflora, and the overall diversity, the type of bacteria we have and the number of bacteria we have. Both these are important. And these are altered in case nutrition is not okay. These are altered They result in altered gut microflora, mucosal permeability, immune maturation, and metabolic regulation. All these functions are affected. What may be the probable reasons? The earlier speakers talked about this. See, one is breast milk versus formula feed. The gut microflora of a breast milk child is totally different compared to a child who is fed on formula milk. Natural food versus commercial food. So the emphasis was on give the child homemade food, mom-made food, and not from the market. Highly processed foods, ultra processed foods are linked to so many problems now. Lowered dietary diversity, because once you give a formula food or let us say a commercial food, you are restricting a child's intake. And of course, finally, the most important is unhealthy balance of nutrients, giving what the child does not require and also giving the child less of what the child requires. So going on to the next slide, there are metabolic modulators both during pre and postnatal development. Okay, that is during pregnancy and when the child is growing also. Which are these? Cytogenesis, the cell development, the organ development, the metabolic and endocrine responses, and the gene expressions. Now, all these would change, and this is called as early metabolic program of lifelong health. So, in case there is an issue with nutrition, all these get affected during fetal life and after birth also. Now, the various situations which we come across and what are the various hypotheses which have been put forward, these are, I thought these are very good, so I just put them onto a slide. It says that fuel-mediated in utero hypothesis, which relates to fetal overnutrition. When fetal overnutrition could occur? In case of maternal obesity, high pregnancy weight gain, diet in pregnancy, and gestational diabetes. Then there is a mismatch hypothesis, which is postnatal overnutrition. When after birth, the child is overfed, there is a breastfeeding for a short time and excessive protein supply. Then there is accelerated postnatal growth hypothesis in case of fetal undernutrition, but postnatal overnutrition. That is, during pregnancy, the child did not get enough, but after birth, there is too much being given to the child. And this can happen in case of maternal malnutrition and placental dysfunction. So in all these abnormal cases, they result in these NCDs, which are there on the right-hand side, you can see in the box. But these are also modulated by environment, lifestyle, and gene. The effect would be there, but you see the various diseases which could occur later in life because of all these situations which are not balanced. Next part of my talk, global nutrition challenges, very briefly. What is happening? Some of the challenges under 5 children. At present, we have 20 million which suffer with severe acute malnutrition. Of these, 7 million would die of premature causes. And of course, here, mostly it is infections and neonatal conditions, which has been covered already. 1/3 of these, they die due to undernutrition, which again is a situation which can be controlled. Iron deficiency example I take because this is something whereas we have 2 billion people suffering with this. 470 million women of reproductive age. So this could affect their head with a proper diet. The causes of malnutrition, 2 most important, which I would just mention, dietary inadequacies, which you are familiar, as well as infectious diseases. Because globally, these are supposed to be 2 most important causes of malnutrition occurring in children. Because infections, they add on to the insult and they affect the growth and long-term health. There are indirect causes, you are familiar, but I'm not really going to deal with that because that itself is a big topic in itself, whether it is household food and nutrition insecurity, maternal and child care, health services, environment, and all. Now I go to the next part, something about early growth and nutrition, to just let you understand how important is nutrition for the growth. See, growth is taken as a sensitive marker for health and nutritional status of the child throughout the childhood. And growth monitoring is also used as a tool because this is something which is very simple to measure, and this can also be done in any resource poor environment also. You only need a measuring tool, that is all. So this is very easy to monitor. And early growth, this is associated with long-term development as well as well-being of the child. Now, in case there is a deviation which occurs in this growth, which may be due to restrictions or maybe due to excess fat accumulation, these cause greater risk of disease, both in short and long term, impaired mental development, and increased risk of NCDs. So, growth during early life is important. And of course, it can be divided into intrauterine, infancy, childhood, and adolescence, but I'm only taking the infancy part of it. Each period has its own demand of nutrition, and it is regulated by hormones also, which play a critical role in proper growth. Now we come to the part on essential nutrition actions as recommended by WHO, because as I said, that this is something we take as a benchmark, and most of these I think have been already mentioned by the earlier speaker. So I'm just going to reinforce this. Exclusive breastfeeding for 6 months, adequate complementary feeding starting from 6 months, along with the breastfeed for at least 2 years, then appropriate nutritional care of sick and malnourished child. I would just make a mention of this also because I thought this is important. And adequate vitamin A and iron for women and children, and adequate iodine for all, because iodine is also something which affects the child's health during when the mother is carrying the child. WHO recommendation for 0 to 5 months, of course, it's the kangaroo care, point number 1. I wouldn't read that again. Exclusive breastfeed again, and counseling and support for low birth weight infants, because that may require extra support, wherein the mothers have to be encouraged to breastfeed more, or in case if that is not possible, then use human donor milk, and then only comes the formula feeding, because formula feeding should be the last on the priority list. Okay, and now these are some scientific observations. Okay, they have seen that breastfed infants have slower growth velocity during infancy, which is likely to have a beneficial long-term effect. This is one reason. They say because the child is not growing well, switch over to formula food. But actually, they grow slow in the beginning. The growth pattern of breastfed and formula-fed infants are different. Okay, breastfed infants grow faster in first few months, but they become shorter at 12 months. They weigh less also, but it is healthy. They gain more fat in the first few months and more lean mass later. This which again affects the long-term health. And there are differences in the protein intake of breastfed and formula-fed infants, both in the quantity and quality of protein. And now we are getting a lot of evidences as to how the protein intake affects the long-term health of the child. High protein intake in early years can lead to overweight and obesity later. Because see, human milk, when you go to the composition, the protein content of human milk is much lesser than other milk source, let us say cow's milk or whatever, formula milk, because that's where the protein content itself is higher. So you have to make it dilute. And if you dilute it, then we miss out on the other nutrients. So whatever way we want to change, it is always a problem when you want to give a milk from outside other than the breast milk, especially in the earlier months of life. There have been some studies also which show that even the mother's health is important when she's breastfeeding. They say that these nutrients which are given in the green in the first column, thiamine, riboflavin, vitamin B6, B12, A, iodine, and selenium. These are affected by the maternal status, and there are group 2 nutrients which are not affected by the maternal status. But just to make that a point that even mother's health when she is feeding is important. Okay. Now WHO recommendation for the next age, that is from 6 to 23 months till the child becomes 2 years old. Okay, they specifically say they continue frequent on-demand breastfeeding until 2 years of age, or even in some cases beyond that if it is feasible, especially in resource-poor environment, because the child will have the protection. Because breast milk is a key source of energy, essential fatty acids is very important for the child's brain development, and also certain micronutrients. The intake of breast milk is maintained even if a child falls sick because they readily take it on. This also reduces the child's risk of morbidity and mortality, especially in disadvantaged population. You already saw a slide wherein the incidence of diarrhea could be reduced because if the baby was breastfed. Long-term studies show that if a child is breastfed for a longer time, then there is a greater linear growth. The catch-up growth is much better. There is a reduced risk of childhood chronic illness and obesity. And there is improved cognitive outcome. And this, of course, as I said, gives protection against diarrhea as well as acute respiratory illnesses. These two are a problem in childhood, most of it. The next part, coming to nutrient requirements and complementary feeding, the various parts which I would be covering below these are as, which I've already told you. See, the nutrient requirements of young children as per the new recommendation which has come now in 2020. I have only taken one representative because this depends on the age of the child and the body weight also. So in case the body weight is, let us say, around 11.7 kg, this is maybe just 1 year plus child. The requirement would be, calorie requirement would be 1010, and this is taken as per kg body weight. So it can be calculated for whatever the weight of the child is. The protein is 13.3. Fiber, there is a recommendation for fiber also. Calcium, zinc, iron, and vitamin A. In the first column, what you see is these are estimated average requirements. This is what has been changed in the new RDA. And what you see on the right-hand column is the RDA, which is the recommendation. Okay. So there is only been a small change from the earlier recommendation, not a major change, but still these have been given as estimated average requirement, which is used, these can be used for calculating the requirement of one child. Now coming to complementary feeding. See, complementary feeding has to be started in the 6 months of life. After the child completes 6 months, that's very, very important. So again here, this represents a critical period of growth as well as development. Okay. And the amount of food which should be given, the complementary food which should be given, of course, we start from 6 months onwards also in very smaller quantities and slowly increase the quantity. But by the time the child is, let us say, about 1 year of age, then they have to receive at least 60 to 65% of their requirement from the complementary food. That is more than 50%. See, the child is being given milk, the child is breastfeed or maybe other source of milk, but so much of requirement has to be covered with food. That is what is very important to remember. The child needs this extra food for proper growth. So what are the suggestions for the dietary intake? What are the practical implications? And see, this is something which makes it difficult to practice it also. One thing is, it requires special preparation for infant. Everything which an adult eats cannot be given to infant. So the mother has to prepare it. The child has to be given frequent feeding, maybe 4 to 5 times, because the stomach size is very small. Milk intake is necessary, It should be mother's milk, but in case not possible, then maybe some other source. But child definitely needs some quantity of milk, almost 500 ml. Vegetables are necessary for macronutrient intake, and introduction of fruits also should be done 6 months onward. This is something which is totally missing out in our complementary foods, because most of the time the child is fed with a cereal preparation. If need be, maybe a dal is added to that, which serves as a source of protein, little bit, a small quantity. But the vegetable part and the fruit part happens to be missing because of so many reasons. The dietary diversity has to be slowly expanded. The child has to be introduced to various kinds of food. This is the time when they develop food habit. So it should not be just a soft cooked rice or a soft chapati and dal, but something much more than that. Following hygiene is extremely important. This is something that is totally missing, especially in the lower state of our society. And this is where the child comes down with a lot of infections once we start with giving complementary food to the child. The other factors, mother's education and awareness is important. So mothers have to be taught how to feed, what to feed, how much to feed. Availability of caretaker, because see, many times in case the mother is working or due to some reason the mother is not staying home, then the responsibility is given to an elder sibling. Are they prepared to take care of this small infant? That's a question mark. Resources needed to feed the child, because you need to feed so many times, you need so many resources, the ingredients, the preparation time, the feeding time, is all that there? Socio-cultural taboos. Socio-cultural factors, because see, we have very strong belief system coming from generation as to what to be given to a child and what not to be given. And if there are elderly women in the families, we have seen that they are the ones who really dictate terms. Now, in case there is no issue and the child is being fed properly with, let us say, taking care of nutritional requirements, that is fine. But we are not sure whether this happens in all the time. That the taboos, like there are so many things which are not given to a child, especially fruits. We have seen in our studies that fruits are just avoided. Okay. Then comes the clean water. And I think clean water is the biggest problem, because there are so many waterborne infections which are bound to occur in case hygiene is not taken care of. So there are issues with practical problem of feeding a child which have to be taken care of. Now, what should guidelines include? This is very specifically for the Indian situation. See, one is quantity. How much of quantity of food should be given? As I said, from 6 months onwards, it can be started, but we start with very small quantity of just a teaspoonful. But then later on, as it goes, then we have to increase the quantity slowly so the child gets enough quantity of food to take care of the requirement. Nutrient density is again important, because the child's stomach is very small. And you all must have heard of ARF, amylase rich food. That is something that we use sprouted or germinated grains to reduce the density of the food being given to the child. Bioavailability. Whatever is being given should be available also, especially the minerals, especially the iron, because we have to give it in a form that it is absorbed maximum. Frequency. How frequent the child should be fed. Food allergies. Food allergies are a common problem, and the mother has to be taught to check the symptoms, signs and symptoms of food allergy in case the child has a problem. Texture and palatability. Again, these are issues. Palatability I would deal again. I would tell you so many more things about that. But then texture of the food also. See, the food has to be in a form that wherein the child can chew it easily and swallow it easily. So obviously the food has to be prepared especially for child. And the hygiene, which I already mentioned. So family meals can be shared, but in family meals, so generally traditionally the practice has been to give a mixture of cereals, which can be, like sprouted or germinated grains, and maybe fresh fruits and vegetables can be added on. Dry vegetable and fruit powders can be added on. It has to be given in the mashed form, pureed foods, soups, juices, finger foods. There are varieties, but there are so many forms in which the child has to be fed. So it can't be just a meal an adult is eating which can be given to the child. And for all this, a caretaker supervision is important. A child cannot be left alone to take care of himself, which does happen in families, and we have seen in our studies that sometimes the child is just left by himself. But at this age, there must be a caretaker which takes care of all these issues. Next question. Are fortified foods or supplements needed for young children? See, in our situation, we know that we do have lot of clinical or subclinical deficiencies, okay, prevalent. It could be maybe iron, vitamin A, zinc, whatever. Okay. The intake of vegetable is very low. Mostly the diets are cereal based, wherein the iron availability is very poor, and dietary diversity is very, very low. So all these results in inadequate intake of micronutrients as well as essential amino acids. So keeping in mind in all this, maybe we need to have either a supplement or a fortified food which can be used for children to take care of these deficiencies or these issues with our food. See, in case we make sure that the child gets something with a normal feeding frequency and the food, whatever we are giving, then it is fine. But as I said, in our condition, that may not be possible in all the time, because we know that all the families will not take special care to make one vegetable for the child and give it. In such cases, fortification becomes essential. And also the reason is, this is something which I've written at the bottom, which you know that after 6 months, the child should have some iron source because the liver stores of iron are not adequate. Then low birth weight infants, especially, they are born with fewer iron stores. So there are conditions, situations wherein we need this fortified foods. And this actually I have picked up from a WHO recommendation of early life nutrition. I thought this was a very important piece of information, wherein they suggest that home food can be fortified with a micronutrient powder to improve the nutrition of young children. And here this sachet, this powder contains iron. I have just given the details in case you need. Then vitamin A and zinc. And this has to be given, the frequency has to be 1 sachet per day, but only for 2 months. Like it says 2 months of supplementation followed by 4 months of off period. So this is on and off, this has to be added on to a child's diet, which will take care of deficiency. And this is advised for population where prevalence of anemia is more than 20%. I think we come under this. And this can be done for at least 2 years of age, so that the child gets adequate nutrients. Okay, next question. Nutrition of a normal child versus nutrition of a malnourished child. Now, whatever I told you was for a normal child. But in case the child is malnourished, then we definitely need to give extra nutrition over and above the normal requirement so that the child can grow up to the normal norms. Now, in such cases, there are some guidelines. One is that if there are complications, then medical care is essential. We can't just keep the child at home and just think that we can, improve the child with nutrition. The formulations have to be nutrient dense. Density is very important. Special attention to be given to the nutritional quality of food which is being given to the child. Supplements have to be provided. Fortified foods must be used. And hygiene has to be followed for reducing the infections occurring again and again. Because we are aiming at catch-up growth. And catch-up growth needs more care than the normal growth also. There are some examples, like in case there are children with severe acute malnutrition, okay, wherein the weight for height is below 3 st of WHO standard, or they have another criteria wherein the mid upper arm circumference is the cutoff point is taken as 115 mm. Okay. Now, in such cases, if the child has normal appetite, then at home it can be treated with maybe with the help of a counselor or a healthcare. But in case some children have medical complication and no appetite, then they have to be taken to a healthcare facility because this is a serious condition. In case child suffer with MAM, that is moderate acute malnutrition, in this case, they can be treated at home, but again, here, adequate nutrition is very, very important. So the essential nutrition actions, they include breastfeeding, promotion and support, education and counseling of families, that's again missing in our context, and addressing the underlying causes of malnutrition, which again I think is another area altogether, so which I'm not addressing, but that is also something which has to be taken care of. Now here I go on to the scientific observations regarding complementary feeding. What is the impact of complementary feeding on later health and development? Okay. Now we know that complementary feeding is needed. One is the causes of nutrition. Breast milk is not adequate. But then we also have one more perspective, that is the developmental perspective. Because child is developing an exploratory behavior. The child wants to chew, hold, experiment, try with all the other foods which are there, not just milk. And this behavior is strongly influenced by social and cultural practices. It is very difficult to assess the impact of this, but definitely it has an impact. Because this is a time period wherein the child develops the taste, the food preferences, and all the food habits which are going to influence his food behavior later on in life. So that part is also important when it comes to complementary feeding. Now let us check on this. That is, what are the potential mechanisms for the effect of complementary feeding practices and the later outcome? See, the effect, let us say, when you see on the first column here, programming effect. Feeding practice results in a permanent change in the structure and function, which has later effect. The best example is iron intake. In case the iron intake is not sufficient, then it will definitely going to permanently influence the brain structure and function. Okay. So finally, what will happen? The entire gut microflora would change and the metabolic process would be affected. Then again, next one, altered taste of food preferences, which will influence the later dietary intake, can have negative health outcomes. For example, exposure to salt or sugar. Once the child starts eating too much of sugar or too much salt, then his taste profile changes. And in case the child is not exposed to vegetables, then they refuse to take vegetables later in life. So you are actually forming all these food habits with the complementary food which is given earlier. Then effect on the eating behavior, the appetite of satiety, the mode of eating, what is being given in the food, all these variables is going to be affecting the child's eating behavior later. For example, you force feed the child, you keep on feeding more and more. So the child gets into a habit of just eating extra every time. And that becomes his norm. He thinks the child has to eat much more than what he requires. So all these complementary feeding practices are going to have a later outcome in terms of food behavior. The next observation, timing of the introduction of complementary feed and what happens to later health. What does the evidence indicate? The research has been done on obesity. They say that the observation is introduction of complementary food early in life, that is maybe around 3 to 5 months. The ideal is after 6 months. It should really be after 6 months. In case it is done before, then there is higher childhood BMI and percent body fat. Effect is seen both in breastfed and formula-fed infant, but this is more in formula-fed infant. Allergy. The studies are not conclusive, but still, the early studies show us that in case there is an early introduction of complementary food to different kind of food, the child may have more allergic reaction because a younger child cannot handle it, wherein an older child can handle it better. So the food allergies would be lesser if complementary food is given after 6 months of age. Gluten and celiac disease, so far we have no evidence to show that these are related. Cognitive outcomes, the studies are very few, but whatever studies are there, they show that in preschool years, there is not much impact. But see, the school years, there was a reduction in problem eating behavior. That means this is impacting food behavior later in life. So when the complementary food is introduced is also very important. The next one, observation, we go to content of complementary feeding and the later outcome. Under this, research has been done on macronutrients. What does this show? A higher protein intake results in higher BMI and body fat. And this is associated more with dairy protein. That means formula feeding. So when the formula feeding is given, the protein becomes more and there is more body fat. Micronutrients. Iron deficiency affects the long-term cognitive and psychomotor development. Again, we have enough evidence for this. Vitamin A affects growth and immune function. Zinc has been associated very well, especially studies done in India. Reduced diarrheal episodes and recovery is faster when zinc is taken. Salt, excessive intake associated with hypertension in adolescents and also in the food behavior later because the salt threshold becomes higher. The more and more salt being given to child, the more and more salt the child wants to eat. So later on, they start eating more and more salt. The method of feeding, of course, again, there are very few studies, but between pureed food and the finger food, there was no evidence to show which one is better. But in pureed foods, especially when it was given to young children, the intake was better and the selection was wider because more number of foods could be included. In finger food, the choice becomes little limited and the intake was inadequate. So the suggestion is that it must be a mixture of pureed food and finger food. The first starting has to be through pureed food and later on they can sort of promote themselves to finger food slowly. It can be like transfer to family meals, which has to be in a slow process and not early process. Learning to eat. Again, this is important because it's only through complementary food that the child learns to eat. So what is the influence of parental feeding practices on the child's eating behavior? A lot of it depends on how a child is fed because this affects the child's cognitive and socio-emotional development. This is where there is acquisition of food preferences. See, the child likes to go by the parents' idea of what is good and what is bad. Let me give you one example. If the parents give a child an idea that the sweet is good, the sweet food is being given as a reward, then they would automatically think that something sweet is very nice. Self-regulatory skills. The child learns when to stop eating and when to start eating. Child's reactivity to food cues. You give them vegetable as a reward, then they think that this is something very good to be eaten. Satiety responsiveness. I was talking about force feeding and feeling full. We have to make child realize, okay, this is what is adequate for you. This is enough for you. When the child says enough, we have to stop. We don't have to force feed. But again, I said this is something which goes on, it depends on parents' behavior as to they have to decide that which kind of behavior they want from the child. Picky eating behavior. Again here, if the parents themselves demonstrate to child, okay, this is nice or this is not nice, the child gets all those cues, all those responses. So finally, food behavior would entirely depend upon what they are learning through complementary food. Now next we come to food environment. See, we can have different kinds of food environment. Food excess or food deficits. Okay, there can be a lot of food, there can be less food, but adequate food has to be by selection only, because we have to learn what to select for the child and what to select even for ourselves, because there is a genetic predisposition to taste like sweet, salt, and umami. And initially, sour and bitter tastes are rejected. The new foods are rejected. The child gets used to umami taste because mother's milk is richest in umami, that is monosodium glutamate. The taste of sweet and salt is because in complementary food, we add sugar and we add salt. Otherwise, they will not develop that taste and they learn. So see, these were there. All these cues were developed in a very different food environment where we didn't have too much of salty and sweet food. Okay, and food safety risks were high. But now the food environment is totally different. We have too much of palatable food with too much of high added salt, sugar, fat, and low in vegetable. So here, how the food cues are changed. It's got to be only by selection, and it can't depend on what kind of foods are available. Foods, different kind of foods would be available, but the choice depends upon the parents. And also it's been seen that breastfed infants, they are exposed to variety of flavors much more than formula fed infants. So they accept diverse foods much more easily, because when the mother is feeding the child, all the flavors which she is eating gets on in the breast milk also. Okay, the traditional feeding practices. Okay, that is something to learn also. But then, as one of the previous speakers said, we also have to examine whether all these practices are optimum good practices or not. For example, in traditional parental behavior, most of the time we see that emphasis is on eating more. So, overfeeding. The child is given food because it calms the child. The mother insists on the child to finish the bottle. Whatever milk is there, you finish it. That's very important, even if the child is full. Finish plated food. The food is there, put on the plate, and you have to finish it. No, instead of that, you have to put less food. Serving large portions. Energy-dense food, which is the present-day problem. Giving too much of energy-dense food to the child. So, all these issues have to be kind of properly examined, because we have to give a proper healthy diet from the beginning itself. And these parenting and feeding strategies, whatever is going on, these can be modified. But as I said, we have so much of social and cultural factors involved. This is very difficult to change these ideas in the society. Coming on to the non-nutritional factors, which are equally important, though I'm really not emphasizing too much on this, but just to make a mention of it to make the talk complete. See, there have been very many meta-analysis of complementary feeding strategies, which show that educational interventions always have a positive impact. And if educational interventions along with provision of complementary food, even that had a greater impact. So that means to say that education has to become a part of counseling process wherein mothers should be taught what to feed, how to feed and everything so that the child is healthy. Healthcare, apart from the medical care, see the health workers can themselves implement complementary feeding, counseling and active feeding services, growth monitoring and promotion, supplementary feeding, food-based intervention, diet, adequate intake of vitamin A-rich foods, high doses of vitamin A, which is done already, and health facilities at community level, which should be utilized. So this is something which is from the community part, which can be done by a health worker and which will help for the children to have a proper early nutritional intervention. Hygiene. This is something again very important. I have written the question, is it the answer for continued stunting despite intervention? Because you know that, taken our own example, the stunting figures are just not reducing in our community, though government has started so many programs, whether it is ICDS or midday meal lunch program or whatever. Despite all that, we see absolutely no improvement, I have to say, that in child undernutrition. Why is that? One reason which is coming now by a lot of studies, which is quite latest, it says that exposure to continuous pathogenic microbes in early life. What is happening? The child is getting infections again and again, especially in a surrounding where it is not clean. Okay, so this results in chronic subclinical enteropathy. And what is happening? This actually is changing the structure of small intestine, and this completely damages the gut so that the nutrients are not absorbed well. And this results in impaired linear growth. So this is one of the reasons which is coming now, that despite giving a nutritious diet, a lot of programs are there, but we don't see much of improvement in our undernutrition profile. The reason could be repeated exposure to infection, which is really changing the intestinal structure and it is damaging the gut. And that's where we have all the issues. This could be one of the reasons even in our setting. Now, continuing with that, what about existing programs, whether they are successful? Under this, there were two programs which were examined, which were there in the country for a very, very long time. One of the studies shows this, ICDS and Tamil Nadu nutrition program. See, it says that it did not target under 3 children adequately. So the young child comes under this category. Did not make a difference in the weight of children, though severe malnutrition reduced slightly, but otherwise it did not make a dent. The education component was not adequate, and this I said that education is important. Anganwadi worker has been overloaded with this. This is something that has been through many studies. Food supply has been irregular to the various programs which go on. Health worker is not trained adequately, and there are poor linkages between healthcare services and ICDS. So this is an evaluation of the programs which are going on. So see, there is this is not a criticism. This is to say that there are so many areas where we can improve. Okay. And this, I don't want to really read it, but I would just refer you to this particular paper, which has come just last year by Puletsko, because so many of my references which I've taken, this comes from WHO, this comes from studies of Puletsko and a lot of meta studies. It says that nutrition during pregnancy, lactation, and early childhood and its implication for maternal and long-term child health. The early nutrition project recommendations. This is published in Annals of Nutrition and Metabolism. And this talks about the pre-conception recommendation, wherein everything has to be improved. Then during pregnancy, what the women needs, and even during lactation. This to say that it just involves all the stages. It's not just the child itself after birth, but all these have to be taken care of Only then we can focus on a healthy child. So the key messages with all this, which come around is that birth, immediate initiation of breastfeeding, birth to 6 months, exclusive breastfeeding, 6 months to 2 years, breastfeed plus complementary feeding and micronutrient supplementation, especially in our situation, I'm telling this is very important. School years, energy and nutrient adequate diets along with micronutrients. Adolescents, adequate nutrition, pre-pregnancy, adequate diet, and pregnancy diet and micronutrient supplementation. So essentially, entire lifespan gets involved just to have a healthy child. So my take-home message is that early life nutrition is actually determines both the lifespan as well as the health span. So this is very important to initiate it in a proper way. Thank you so much to all the participants as well as to the organizers for the patient hearing. If you have any questions, I can answer.
Thank you very much, ma'am, for elaborating on the essential of nutrition, especially in infants and young children. Audience, if you have got any queries, you can put it in the chat box so that I can pass it on to madam.
Lower chat box.
Afterwards also, I think if there is any queries or any doubts are there, you can definitely put it in the chat box, or you can send it to us so that I can convey the same thing to madam and get the answer to it or solution to it. Okay. Now, coming to the presentation, I think madam has elaborated on the essential of nutrition in continuation of the previous eminent speakers who spoke about the importance, how to take care of the infants and the newborn, and how important is breastfeeding, and why it is so essential. So to boost up with that, or to add on to that, even the nutrients that are very important or play an important role to the future of the child also. Madam has emphasized on the early nutrition. Then she also spoke about the challenges that are there, that we are facing because of the nutritional deficiency, that is malnutrition, which is still persisting in the world and as well as in India. And she also highlighted the essentiality of nutrients and the effect of nutrients on growth and development in the children. It is not just physiological growth, even the psychological growth also was being emphasized. That is the learning capacity or learning ability was also explained over there. And madam further told about the essential nutrition actions that were taken by WHO or UNICEF with regard to the nutritional deficiency and other aspects. She further told about the complementary foods also, how it is important, and what happens if the complementary food is not followed properly. There was highlights on the behavior, that is food choice and food behavior, which is based on the selection of the complementary foods, and also how important role a parent takes place in the future of the infant was also being highlighted over there. Further, there was the role of fortification and supplementation, how it could be done and why it is essential was also being emphasized by madam. So on the whole, we had a very big review of all the possible papers which supported and which told us that nutrition plays an important role both in the infants growth and development as well as the younger children, which may have its implication in the future life also. So I thank Madam on behalf of the organizing secretary and the convener and the whole team for giving us or for elaborating us on the nutritional aspects for infancy and preschool. Thank you once again, ma'am.
Thank you, Anita.
Thank you.
Thank you, Dr. Anita Singh, ma'am, for moderating this session. Well, we have reached the end of day one of the National Webinar on Challenges of Neonatal Care and Infant Protection. We look forward to meeting you all tomorrow on this virtual platform for another day when we talk about these sessions. Thank you.